Good morning, everyone.
Please take your seats so that we can start with today's session. Good morning, and welcome to the second day of the 92nd General Session of the World Organization for Animal Health. We hope you had time to recharge, because today it's all about action. This morning, we come back to our forum, the Animal Health Forum, entitled Veterinary Vaccines and Vaccination, From Science to Action, Reflection for a Change.
Yes, yesterday we set the stage. We heard from global leaders. We opened our Animal Health Forum, and we celebrated outstanding contributions to the world of animal health. But today, it's time to roll up our sleeves and delve deeper into the real challenges and think of the real solutions going forward that shape animal health worldwide. And as Mara said, our focus is crystal clear. This is all about science to action. We're going to explore more the practical realities of vaccination, from decision-making to access, from innovation to impact. Now, please remember, we have interpretation available. You can use your headset and select your preferred language.
Thank you, Dan, for reminding us to use the headsets, because I would really like to introduce this person in our native language. Quien abre esta sesión es una veterinaria.
And the person that I'm introducing today is a vet with a notable experience. She started working on the field. She's very aware of the challenges and the needs, and she fully understands the existing capacities to meet the specific challenges. And she worked at a national level by implementing all standards for the livestock trade and sustainable livestock trade. She's very well known. You know her very well. And thanks to her integrated vision and her leadership skills, she allowed us to reinforce animal health in the entire world. So it's a great pleasure to hand over to Director General, Deputy Director General, Mrs. Dr. Montserrat Arroyo.
Muchas gracias, Mariana. Muchas gracias, Dan.
Thank you very much, Mariana. Thank you very much, Dan. Can you hear me well? Yes. Thanks again. Thank you very much.
To give a very warm welcome to our two rapporteurs. They are the brains of this operation that have been tirelessly working for the past 8 months with a team of very committed WOAH staff of about 15 people, and that have been able to gather about 30 speakers for these panels. So first, I would like to give the welcome to a great colleague and WOAH friend. We call him Bati. He's Dr. Batiste Dungu, and he's a veterinarian with a PhD in vaccinology, and while he looks quite young, he has more than 25 years of experience in vaccine research, development, manufacturing, regulatory quality, and commercialization. I say he's a great WOAH collaborator because he's been a member of our scientific commission since over 10 years. He's also a panelist of the One Health High-Level Expert Panel, OLEP, that was established by WHO, FAO, WOAH, and UNEP. He's also a board member of the International Veterinary Vaccinology Network, a member of the group of experts on animal health for the African Union, and also sits on the steering committee of AU PANVAC, but he's also currently an associate professor of infectious diseases and immunology at the University of Kinshasa in Congo. Thank you, Dr. Bati, for the great work that you've done so far. And I'd like to also introduce our second rapporteur, Merichelle Donadieu. She's also a very good friend of WOAH, who has supported some of our work on parasitic zoonosis. She's also a true citizen of the world in the true sense, since she has lived and worked in over 7 different countries throughout her career. She's a veterinarian whose great interest in public health has led her for the past 15 years to work in this interface between animal health, public health, and development. She has worked in different fields in the private sector as a swine veterinarian, later as Director of Operations for the Global Alliance for Livestock Veterinary Medicine, and she's currently a Senior Fellow at the University of Melbourne and has been working for the past 7 years as a consultant to WHO and its regional offices on neglected parasitic diseases. Please, Michelle. They have really worked as a team to bring together today. They have provided the animal health technical item, and they've really worked very hard. And what we really expected from them, they have delivered above and beyond. Thank you so much.
Thank you very much, Montse. Dear colleagues, hope the presentation will be put on. It's a great honor for us, Marichel and myself, to be associated with this work that was quite daunting but wonderful. So we'll be talking about vaccine and vaccination if we get the slides on the screen. But you probably have seen the paper, you went through it, and the focus is really, it will be covered over the coming days. The 6th session that will be taking place will be focusing more on challenges and opportunity related to it. So we heard since yesterday that vaccines are very powerful tools for disease control and management, but they are not always used to their fullest potential. We also heard that successful vaccination require that the vaccine is available, accessible, and accepted by the public. So you've seen in the paper the equation that we put there, which illustrates vaccine adoption, which basically is vaccination. For vaccination to be successful, you need a vaccine to be available, so it exists. Vaccine to be accessible, in French you'll say disponible, so it is there. Accessible to both farmer users and animal owner and veterinary service, and it's also demanded by the people. Although it's quite theoretical, this separation, but it's very helpful to understand the concept and set the discussion. So, and this is applicable both at farm level, or animal owner level, as well as at national level. But the emphasis may be different, but it's really the basis of what you require for a vaccine to be adopted and vaccination to take place. So we won't be getting in detail into the different components, but we'll focus more on the challenge now, and the opportunities will be further discussed in the sessions that are coming. So if we start with vaccine availability, we looked into the challenges. There's probably quite a lot of challenges, but we focus on 4 of them for this discussion. The first one being the fact that there seems to be always a lack of consensus on the desired attributes of veterinary vaccines. Colleagues who are familiar with the medical side, they would know that the WHO has they use also what is called target product profile, which the industry also use. It's basically a document that describes the attributes that are the minimum and ideal attribute of a vaccine based on the use that the vaccine is for. So if you want to develop a vaccine for eradication of a disease, it's different to, for example, a vaccine for control of a management of an existing disease. So such documents are then published. The WHO, the way they do it is they publish them. They are developed through consensus with all the stakeholders, and then they are published so that everybody, including researcher, can work on that. So there's an opportunity for WOAH to look into it, probably in the manual. The other opportunity or challenge that is there is related to aquaculture. We know that vaccines are more and more used, extensively used in the aquaculture sector. But if you look into the aquatic manual at the moment, it just speaks about the vaccine, but there is no much requirements that are included. So this is a low-hanging fruit, I think, for colleagues from the Aquatic Commission to look into, see how they can include more details on vaccine requirements. And another aspect that we heard also a lot about yesterday is in terms of innovation, there's a lot of technology that have been coming up. A lot of vaccines research is conducted and adaptation of vaccines into new technology, but very little of it has been translated quickly into commercial products. And there are many reasons to that. You have lack of funds, intellectual property issues, or sometimes the regulatory service doesn't adapt quickly into changing vaccine profile. So there again, there's an opportunity to support, to come up with mechanisms that could assist in accelerating the adoption of new technology into product. And then linked to that is the issue of genetic resources. As we know, for developing vaccines, usually you need access to genetic material. And there's been a convention that was adopted globally, I think in 2010, which is called the Nagoya Protocol, which was put in place really to assist in exchange of genetic material between institutions. But colleagues that are in research know that it's many cases it's become a nightmare because of the interpretation of the Nagoya Protocol by different countries. And here again, there is a great opportunity for WOAH and member countries to come up with guidelines and facilitate the harmonization of interpretation of what the Nagoya Protocol is for, so that it could accelerate vaccine research and development of new vaccines. Now, the other area which is critical for availability of the vaccine is the production capacity. There's many cases where limited capacity makes countries to struggle to have access to certain vaccines, especially countries that are producing vaccine by themselves. May not have all capacity to produce all the vaccines that they need. And it's not always necessary for a country to want to produce all the vaccine. There are many mechanisms that one can explore, either public-private partnerships or collaboration at regional level. We heard at African Union, for example, level, where they're looking into capacity at continental level. So those are opportunities that one needs to look into to build production capacity. Now, the second area is vaccine access. As mentioned earlier, this is really vaccine being available, ready to be used. The two areas are usually of challenge. You have issues of registration of the vaccine, and then you have issues of procurement. In terms of registration, there are many countries still that do not have regulatory authority within them to register vaccine. And some others rely on the registration process for pharmaceuticals or for human medicines. And they are not always fit for purpose for veterinary products, for veterinary vaccines. So there's really an opportunity to look into different mechanisms that exist. Nowadays, many regions are looking into harmonization process and mutual recognition. So there are many processes that could be considered by country to fit the gap in terms of availability of access to register products. And the other aspects linked to registration is what is called minor use products. You have products like vaccines for rabbits, which are not in big use, not very profitable for commercial company, or product for neglected zoonotic disease, for example. the registration should be different to the normal process of registration of many other vaccines. Similarly, with emergency vaccines, the veterinary service should be able to have access to to put in place mechanisms such as a dispensation for the use of such vaccine in a short period of time, or come up with reduced process for registration of such product, which exists already in some part of the world, like in the EU. And then the issue related to procurement, we heard yesterday about the forecast. It takes many months for vaccines to be ready. So there is a need for regulators for country to put the order as quickly as possible so that the manufacturer can work. The WOAH has a guideline for procurement forecast of vaccines, but I think it's important that countries try to harmonize that with their own procurement policies to be able to put orders early enough for the manufacturers to supply the vaccine on time. Another area that has been spoken about is the pre-qualification process, which the WHO is already in place. It's used quite extensively. On the veterinary side, it's been, I think, only used, applied by the EU FMD program for foot and mouth. It hasn't been applied yet to other products, so it's an area where I think there's a need to see whether it's cost effective for it to be expanded to all other vaccines, but I think we'll hear more about it, I think, later today. And then another strategy concern with vaccine procurement is the issue of vaccine banks. We know that the WOAH has vaccine banks that have been put in place, but as we know, they are for a limited number of products. They haven't been expanded to all other products, and there are many issues that need to be addressed in terms of the accountability when they are regional or national or at a global level. So those are a few of the points related to vaccine access that we've looked into. I'll pass the word to Mary-Chelle for the rest.
Thank you, Bati. Okay, can you hear me? So now we are going to look into the last component of this figure, that is vaccine demand. So when we look at the vaccination decision-making process, there are important socioeconomic and technical considerations. And one of the challenges is the lack of guidance based on information and evidence to do the vaccination, depending on the objectives. So for example, if I want to control a disease, if I want to eliminate a disease, if it's an emergency, so what type of vaccine should we be using? Which type of animal should be vaccinating? When? So it's important that we have this guidance and based not only on the technical aspects, but as we heard yesterday, we need to incorporate also the socio-economic considerations. And that's where cost-benefit studies or knowledge, attitude, and practices need to be considered. And the challenge is how to generate this evidence, how to collect this evidence, and transform it in appropriate guidance for the different settings. Another challenge is the insufficient development and use of technologies that can increase vaccine adoption. And with this, we are talking about single-shot vaccines, combination vaccines, or thermotolerant vaccines that really can facilitate the logistics. But if we want to develop good vaccine strategies, we need to know how they are performing. So it's very important that we do a monitoring, that we monitor the efficiency, so how well are we implementing the vaccination without wasting resources, and we monitor the effectiveness, so how well the vaccination strategies are performing on the field. And one of the challenges is the limited guidance on monitoring and evaluation for certain diseases. So we need to know what we need to measure, so what are the indicators, and how are we going to measure. So depending if we are of what our objectives are. So if I want to control, if I want to eliminate, what I have to measure. And we need to know these indicators, how to measure. So for example, if we are going to look at vaccination coverage, what's the denominator? It's total population, eligible population, what type of population? So we need to define that. Once the vaccines are in the field, we assume that the vaccines are good and they are safe to use. But it's very important that we detect and prevent unexpected, unwanted adverse events. And that's where vaccinovigilance plays a very important role. And vaccinovigilance is like pharmacovigilance, but implemented on the vaccine section. WOAH has already some guidance on vaccinovigilance, and we believe that this could be expanded. And also another challenge is that in many countries, vaccinovigilance systems are weak. And it's very important to strengthen the systems, especially to develop trust in the people. Another challenge is that the funding for vaccination campaigns can be limited or not available. And there are many funding mechanisms. Can be government-led vaccination, can be subsidies, can be total or partial recovery, sanitary mandate, PPPs, etc. And it's important that for each vaccination strategy, we use the right funding mechanism. We also need to consider that when vaccinations are funded by the government, that they might have their priorities and they might have some constraints on those priorities, but we need to remember all the benefits of the vaccines to also be able to find funding for when vaccines can help with AMR, for example, or with neglected zoonosis. And talking about funding, we need to be a bit more innovative. A lot of the funding that we have is vertical, is by program. And we need to start thinking about integration to be more efficient. So, for example, if we are in a remote area and we are vaccinating for PPR, well, if it's applicable, might as well also vaccinate for sheep and goat pox or vaccinate for hydatid disease. We need to be starting thinking how can we be more effective and how we can integrate. And the last challenge I wanted to mention is about vaccinations and trade barriers. You are very familiar with this. We heard about that yesterday. So I'm not going to go into details in this because we are going to have a specific session on this tomorrow. And with that, we have gone with Batty through the challenges on the different components in availability, access, and demand. As we say, it's an arbitrary classification, but it helps us to go through them. And also might be that you can think of other challenges. And yes, fair enough, I'm sure that there are more. But what we wanted is to bring some of these challenges to your attention. So during these days, during the Animal Health Forum, we can reflect on them. And then we can see each of us as a member, as WOAH, as individuals, how can we produce the change so we can utilize vaccines, we can adopt vaccines, and we can get the full benefit of the vaccines. So with that, I would like to thank very much WOAH and all of you. Thank you on behalf of Batty and myself.
Yeah, I think the next...
Thank you very much. Thank you.
Congratulations.
Sorry. Yes, thanks to both of you for the presentation and the hard work on the technical item over the last couple of months. And if you've not done so already, I highly encourage all of you to read the technical item, which you can find on the WOAH General Session website, where you can go into the Documents tab, scroll down to Technical Documents, and find the technical item. And Dr. Dungo and Dr. Donadeo have done such a fantastic job distilling such a vast and complex subject into this excellent summary, accessible for any audience. Now, I'm sure many of you will have questions for our rapporteurs. And just to note, we'll have a QR code which will appear on the screen any minute. And you can pose questions to the rapporteurs and to other experts in a panel later, which will be tomorrow for closing the Animal Health Forum Session 6. So our team of WOAH staff are behind the scenes sorting through those questions, and we'll have them ready to pose in Session 6 tomorrow.
Exactly, Dan. Thank you. Yes, tomorrow morning, in the technical session number 6 of your program, we will address all your questions. So please make sure to scan the QR code and leave any comments or questions that you want us to address. Well, now we start with the first technical session. Technical session number 1 has a really artistic title. The title is "To Vaccinate or Not to Vaccinate?" That's the question. So, delegates frequently face situations where the use of vaccination creates some tensions among various stakeholders, could be society, producers, or trade partners. So this session will explore how delegates, how producers navigate these conflicts, and also how WOAH can facilitate the decision-making in this sort of complex scenarios. To start with the first session of the day, we will have a video that will give us a better understanding of the question proposed for this segment. So, vaccinate or not to vaccinate? That's the question, and let's see the video.
What's with the endless chit-chat? As we sit here arguing, my animals' lives are at risk. I'm telling you, we're running out of time.
But I'm worried mass vaccination could shut down exports. Countries may end up refusing our products for years.
I hear you, I do. And I do understand both concerns. So vaccination could stop the outbreak, but international trade restrictions could be devastating for our country's economy. And then we will need to make sure to have enough vaccines, enough trained personnel, and one clear strategy, including an exit strategy. And this is the only way that we will be able to ensure that our vaccination program is effective in stopping the spread of the disease.
Look, if we don't vaccinate, I could lose everything. These animals, they're not just numbers to me. They're my entire livelihood. And if it comes to culling all of them because we were too afraid to vaccinate, what am I supposed to do then? Will there even be compensation?
And if we do vaccinate, you might not be able to sell your animals anyway due to the export bans. Either way, we're facing losses.
Which is exactly why we need to have a consensual decision here. So listen, we need to consider both the technical aspects, but also the socioeconomic consequences that any decision that we make here will have in the short, medium, and long term. Perhaps targeted vaccination, together with zoning, and of course, enhanced biosecurity and surveillance could be a middle ground here, right? But even then, enforcement and compliance will be key in this situation. What do you think?
So there we went back to our fictional WOAH member of Norderland, and you saw the discussion of the CVO with two of his stakeholders, and we heard some of the criteria of whether or not to vaccinate and the need to balance technical aspects and socio-economic consequences. And now we're going to move to an exciting panel discussion to elaborate more on some of these points. So I now hand over to Dr. Dungo.
Thank you. Should I move here?
Yes.
Thank you, MC. It's a great pleasure now to get into the discussion. Can you hear me? Closer? Oh, yeah. Yeah. So we have quite a good panel that will be participating in this discussion. I'd like to call first Dr. Hendrik Jan Roest, who's the Deputy Chief Veterinary Officer for the Netherlands, and is attending on behalf of the delegates for the Netherlands. Thank you, Doctor. And then our second panelist is Mr. Julian Madeli, who's the Director General of the World Egg Organization. We have Dr. Alan Azegele, who's the DVS and WOAH Delegate for Kenya. The last panelist will be Dr. Bao Chu Huang, who's the Director General of the Bureau of Animal Husbandry and Veterinary Service, Ministry of Agriculture and Rural Affairs, Delegate of the Republic of China, and President of the Regional Commission for Asia. Thank you, colleagues. welcome to this panel discussion. The first question will be to Dr. Jan Roest. That's correct, my pronunciation, yes. So the Netherlands has been at the forefront exploring vaccination as a tool against AI, avian influenza, and recently procured vaccine in response to the incursion of foot and mouth in Europe. So what key factors led your country to consider and prioritize vaccination despite the trade repercussions?
Well, thank you very much for this question. It is really a discussion point in the Netherlands because we are facing huge HPV outbreaks back in 2003, but also in 2021, 2022, 2023. And this cost a lot of efforts, a lot of killing of birds, also, well, the livelihood of farmers are at stake. And so that's one side. On the other hand, we also have improved techniques, improved vaccines, improved laboratory techniques, improved surveillance programs. So when you in total look at it, well, you might go for a vaccination strategy, although there are a lot of questions on that. But in a current situation where we don't vaccinate, we have the culling. That's one side, but we also have the zoning, we have the continuation of trade, and that is a system where we are used to. And I think, well, we accept a certain risk. The trade is not a mechanism to spread the disease, we know that, but if you're really going to calculate the risk of the current strategy, you can't say it is a zero risk. And when we are now looking at new strategies, including vaccination, we are calculating and calculating, we are putting on models, and we only accept a zero risk, or maybe we accept a -0 risk. And I think, personally, is that in balance with each other. So why are we posing a 0 or a -0 risk when we are looking at new strategies, vaccination strategies, and we are accepting a certain risk, and we know that the risk is minimal at the current strategy? I think there should be a better balance between the current situation and the situation we want to go to, because vaccination has a lot of benefits. Benefits in not culling animals, benefits in the cost, benefits also in the social upstand, because people don't accept culling of animals anymore. We had back in 2001 a huge discussion on the culling of cattle concerning foot and mouth disease. There were riots and there were also legal infringements because people doubt the diagnostics. So culling or the current strategy, well, has some hamperts, has some drawbacks, and I think we really should go to the new strategy, including vaccination, but we have to relax a bit on the risks. And of course, I don't say that we should put it at hamper. We should give safeguards. We should give a good surveillance program, but be reasonable. And that is, I think, the message I want to give. Thank you.
Thank you for the good point. I think just maybe before we move to the next, one point that you may want to elaborate is basically on what was discussed yesterday. What was the role of the production sector and the civil society into the decision making in this case?
Well, I think they play a very important role. Of course, at first hand, the animal owners and the sector has a primary responsibility in the control of diseases on their farms. Well, of course, we have the notifiable diseases, the list A diseases, as we call it in the animal health law. There also are legal obligations, and the government play a role in that. So I think we there have a shared responsibility. And, well, we can think about strategies, we can think about also surveillance strategies, but it has to be paid also by the farmers. And it has to be implemented by the farmers. So taking them into account is necessary to have enough ability to go forward on the strategy. When you have your farmers against it, it doesn't work. So we really have to do this together.
I think it will be a good way to pass into Julian. Because, so Julian, can you tell us that the fact that there are different opinions within the poultry sector, specifically the laying hens sector regarding the use of vaccination? How do the laying hens sector you represent mobilize, define and consolidate their opinion with regard to avian influenza vaccination? And how many these views be communicated effectively to national decision makers?
So thank you very much, and firstly thank you to WOAH and Dr. Souberan for organising this really important event and for the opportunity to take part. The short answer is that the egg-laying farmers that I speak to are united in their view. As World Egg Organization, we represent egg farmers, big and small, around the world. And they are the people who are often on the front line of dealing with HPAI. And unfortunately, of course, it's zoonotic. So as an egg industry, we're working really hard to ensure that avian influenza stays at a farm level. But for many years, we have been championing biosecurity. We have been trying to make sure that's the most effective it can be to control this disease. And this includes developing practical tools at farm level. And we do that in a way that takes the high-level strategies developed by WOAH and other quadripartite organization and turn it into practical on-farm tools. We've seen that increased biosecurity can have really good practical results. But also we have seen that really good farms with really good biosecurity are still succumbing to the disease. So we realize that we need another tool. And that tool which is available is vaccination. It's as well as the rapidly changing nature of the virus, we have this challenge that biosecurity is not enough. Egg producers are united in their desire to have vaccination available to them, but of course it has to be properly implemented, and it's in addition to the appropriate level of surveillance. And for us, the appropriate level of surveillance is either the appropriate level of surveillance for us is to make sure that the vaccine being used matches the virus that's in circulation. So there's some other countries have different levels of surveillance, but for us, the key is to make sure that the vaccine matches the virus in circulation. Of course, we're very aware of trade concerns, and there's other sectors of the poultry industry which are really worried about this, and you know, they're legitimate concerns. You can also see that there are countries who are taking steps to ensure that this doesn't disrupt the trade. And there's several really good examples out there, but it's still a legitimate concern. At World Egg Organization, we have got a global expert group on avian influenza, and many of the members are in the room today. And they were very quick to realize that biosecurity was the primary tool, but because of the nature of the virus, and particularly how it's behaving in wild birds, they've also understood that we need to move towards vaccination now.
So that seemed to be quite a shift indeed. And how do you see that evolving in the medium and short, medium term? I mean, the use of vaccination now that you're adopting it.
So, of course, different countries, it's obviously a country decision, but I believe that we are on the journey to vaccination more widely globally. if you add together vaccination for HPAI and low path, you end up with billions of egg-laying hens being vaccinated every year already. And vaccines is a very normal way to control a disease, providing it's done correctly with the correct level of surveillance and is done properly. And we're also in the situation where today HPAI is not transmitted human to human, and that's obviously a very good thing. But each time that the virus multiplies, there is the chance of mutation. And this is something that we're obviously concerned about. And the situation could change quite rapidly. Vaccination of laying hens is available. It's considered a useful tool by WOAH if done properly. There's more than one vaccine available. There's several, so that you can choose to suit the right situation. Yet many national veterinary authorities have decided that are still using slaughter for disease control and mass culling. We think it's time to go further than that. We think that HPI vaccination can reduce the risk of shedding. Therefore, you reduce the risk to the human population, you reduce the risk to the animal population, and also you reduce environmental contamination. So right there, you have a One Health solution right there. So for us, we think you do have to address the trade concerns. We do have to take that seriously. You do have to make sure that vaccination is not priced out of the market, and what I mean by that is to make sure that the surveillance program is appropriate. It's appropriate for the virus that is circulating. And I think with that, we would ask under the One Health principle that veterinary authorities do have really meaningful conversations with their health counterparts to see if we can get away for more countries to move towards HPI vaccination, provided there's correct surveillance and provided that it's in addition to biosecurity.
Oh, great, thank you very much. So I'll move to Dr. Azegele. Well, the question that I'll be asking, I think, it was great that your minister was here yesterday and he covered it extremely well. We've read about the impact of misinformation and disinformation around the national vaccination strategy in the country, in Kenya. So how did it happen? Could you share your experience in managing both the disease and the parallel challenges posed by misinformation campaigns?
Thank you. And I also want to appreciate WOAH for giving us this opportunity to share our experiences, more specifically with regard to this very thorny issue of information and misinformation. Indeed, we consider the private sector, civil society, veterinarians and all those as very, very critical audiences or stakeholders who would play a major role in delivering on our vaccination program. So our vaccination program was focused towards addressing two very critical transboundary animal diseases, that is foot and mouth disease and peste des petites ruminants, that is PPR. And the president himself, in one of the national celebrations, outlined the government program towards addressing these diseases, and it was intended very well to cover to actually protect the population of over 70 million animals, that is cattle, sheep, and goats. We proceeded well, and also with support from WOAH, collaborating with VSF Germany, VSF Swiss. We proceeded and undertook vaccination, launching various campaigns in different counties within the country. Along the way, and as it gathered momentum, and the president very convinced about it, he took every opportunity he had to relate whenever he had an audience that involved farmers. And then somehow there was a twist. Political interference just kicked in. And this is where we were caught seriously off balance. There were claims of the agenda behind this vaccination program being fronted by foreigners, and it was intended to modify the genetic formation of our animals so that they cannot pollute the air, and also go ahead and manipulate the animals to an extent that they'll be not productive, to ensure that our livestock keepers are literally impoverished. That was not something that, those are claims, of course, which were not substantiable. You can't substantiate such claims. And to further, the source of the vaccine itself. It was said it's being imported, and that is the actual reason why this program and even the funding is not within. So those are some of the factors that came through, and we were, literally the government, we were accused of being not transparent about the whole program. So actually the effect was so pronounced that it caused a lot of confusion and a lot of erosion of public trust in this program, to the extent that we had a lot of speculation being peddled. Social media kicked in, and technology, trust me, has advanced to the extent that the moment a post is put in the social media, within minutes, it's all over. So, and the youth picked it up and hyped it even further. So you have to play catch-up in such a situation. Having this information even reaching that very rural area where these farmers are, and they're the cattle keepers, and they're getting these signals that your animals are in danger whenever if this program is put into action. So we had to look at it and now organize ourselves very fast and had to respond. But we have to keep in mind that we have to focus on the facts as veterinarians, not fall into the space of misinformation or trying to justify claims that are not scientifically justifiable. So I wrote out a press release clarifying the importance of the vaccination program, the source of the vaccine, the need and the benefits of the program to the country. The safety of the vaccine was very critical. And this was followed very closely with media engagements from the minister, from the principal secretary, from myself, trying to now just hit the public scene and counter this information. Further, knowing that we have the professional associations, which had even challenged us to postpone the whole program because of lack of consultation. I had to sit with them and outline very clearly how the program was organized, what we intend to do, their role, considering that they are the ones who are supposed to pass the correct information to the farmers. And they are the trusted persons, because whenever the animal is sick, the farmer will call on that veterinarian next within the area to respond. So I took time, had an engagement of over 438 veterinarians, and made clear. And the message was, we need to disabuse this notion, because it was going to really affect everyone. Further, now I had to go further down to reach out to the community leaders. We have group ranch leaders and who have a great influence on the very livestock keepers, and two, on the political formations at the grassroots. Because if they make a decision on who is to be elected, they will. The whole community will follow. So we had engagements, and they were very clear. When they understood the whole purpose and where the government was focused, they took it up and pronounced themselves. And that had a significant impact on changing the narrative. Now, further was the county administration who are supposed to implement the programs. We had to engage the county governors, we had to engage the county executive members and the county directors of veterinary services so that they go ahead and be able to ensure that we deliver the program without a lot of misinformation or having the buy-in of the whole system, and then they provide the resources to deliver. So it was really an experience, and we were caught. And communication, I realized, was key. Thank you.
Great. I think we heard it already yesterday. Communication is something, probably as vets, we need to start really training it more, be more trained on communications because we're dealing with a lot of such issues. Thank you. Thank you very much. And then I'll move to Dr. Bachao Huang. Thank you again for joining the panel. So China is significantly investing in R&D to produce veterinary vaccines to support national control program, for example, HPAI, foot and mouth, etc., and facilitate national safe trade. Other than avian influenza, what are the elements that influence China's decision to invest in vaccine development and implementing vaccination program?
Thank you.
Me more clearly. 中国呢，养殖
With a large-scale animal production sector, China produces approximately 175 million tons of meat, eggs, and milks in 2024. And there are more than 60 million livestock and poultry farms in the country, with small and medium-sized ones comprising as 90% of the sector. The growing demand from consumers for diversified products along with frequent trade in animals and animal products imposes extremely high requirements. And limited the to address these challenges, China has implemented a compulsory vaccination policy focusing on major animal diseases. When we talk about Chinese policies, for example, the quality of vaccines, the price, the supply. Now, so I will present to you how China addresses these challenges. Firstly, we improve vaccination quality. Actually, we sorry. So each year, more than 6.5 million pathological samples are collected by animal disease control services at all levels for the detection and evaluation of strain variation, thereby facilitating the update vaccine strain and enhancing vaccine matching. We actively encourage enterprises to increase their investment in the in the research and development of animal vaccines to improve vaccine quality. Over the past 3 years, vaccine companies have annually allocated over 2 billion yuan for research and development purposes. As a result, the research and development platform for veterinarian vaccine has been increasingly improved, and its scope covers a wide variety of vaccine types such as viral vector vaccines, and submit vaccines. Moreover, the platform has demonstrated increasing robustly capacity. Secondly, after the reasonable compensation and improved services provided by a veterinarian organization to improve the accessibility of vaccines. And thirdly, a variety of measures have been adopted to enhance the systematic management of animal disease. In addition to maintaining effective vaccination programs, an integrated strategy has been adopted, including the protection of susceptible animals, the elimination of infection sources, and interruption of pathogen transformation routes. And fourth, relevant vaccination policies are being scientifically evaluated and dynamically adjusted. Vaccination serves as a critical tool for the prevention and control of animal diseases. In 2005, for example, there is another example about the response to the incursion of Asian FMD at that time. And considering outbreaks occurred in several provinces, we immediately initiated the vaccination progress. So, to summarize, China always follows the principle of scientific foundation, precision, systematic planning, and dynamic adjustment in the research and the development of vaccines, as well as the implementation of vaccination policies.
A small follow-up question. Can you explain how vaccination is supporting sustainable disease control strategy to facilitate safe national trade? What lesson can other countries learn from your approach?
I think we need to consider safety as our priority. China implements stringent safety and efficacy evaluations. We require all the vaccines to be safe for animals. There shouldn't be any lesion, any major side effect. There must be no virus shedding. Furthermore, every vaccine will be market approved. Once it is on the market, there will be sampling to verify its efficacy and safety. So if it is efficient and safe, then there shouldn't be any trade bans for it. There are many factors to take into consideration. But if we want sustainable vaccination, we must ensure that vaccines are safe. We must provide safe vaccination campaign services. And then we also have to use science-based solutions to evaluate. And then we need to withdraw when necessary.
Thank you very much. And once again, I would like really to thank the panel for very, very useful contributions. I think we will ask, I'm sure she was taking notes. Mary Chell will try to summarize the point that have come up, but I think there's been quite clear lessons that we can all learn from the presentation that were made. So, Chell, what is...
Thank you very much, Bati, and thank you very much to the panelists. Very interesting messages. I really enjoyed your contributions. I'll try to summarize. You gave me a good challenge there. But there were some key messages. Let me take my glasses so I can read. So I think it's, we heard about farmers and people wanting to use the vaccine. Mr. Madley explained how the members of the EC organization want to use the vaccine, but they want vaccines that they are good, that they are effective, and the same, the delegate from China was mentioning the wanting of vaccines that are safe and efficacious. Also, but those vaccines need to be part of a surveillance system, of a good surveillance system, and I heard this mentioning of surveillance from several of you. And this is the one thing of the vaccines, because biosecurity is not enough. Biosecurity alone is not enough, so we need the vaccines. We need practical tools at farm level, and that was a very important message. But those vaccines need to be safe and efficacious. Now, another important message, and I don't think I can have enough time to emphasize, is the importance of information and misinformation. We heard that from Kenya, clear and loudly, how the importance of trust, developing that trust, transparency, and focusing on the facts. I think that was also a very clear message. We also discussed about the impacts of vaccination on trade. And I think from the Netherlands came very clear the need for a more balanced and updated approach to risk. We have advances. We have new vaccines, we have new surveillance methods. So we need to have a more balanced approach to risk. And especially, again, how we can apply that surveillance. And we go back to communication, to information, and trust. And here for trade, we're talking about communication not at national level, as we're talking with Kenya, but we're talking about good communication between the trade partners. I hope I cover more or less the key messages. If you think I missed a key message, please let me know. Okay, thank you very much.
Thank you very much, the panel. I think the message are quite clear, and they're all going in the same directions, and should make it easier, I think, for Secretariat to put the resolutions together with the delegates. So really, thank you for your time and the message given. Thank you.
Thank you. Oh. There you go.
I'll go down, right?
Thank you very much, Dr. Dungu, Dr. Donadeu, and all the panelists for this first session of the technical item at the Animal Health Forum. Thank you for guiding us through this first technical session. What we have just heard is a reminder that vaccination is not just about science. It is also shaped by many other actors, producers, communities, trade partners. But once the decision of vaccinating is made, we face another big question. Now that we have the vaccine, do we have the vaccine we need when and where we need it? That's exactly what we are going to discuss in this next session, bridging gaps to enhance vaccine availability. Over to you, Dan.
Thank you, Mariana. Indeed, developing and producing vaccines is often a slow, expensive process. And challenges like limited research funding, competing industry priorities, intellectual property hurdles, unclear protocols, and production inefficiencies all affect the quality, affordability, and access to vaccines. In this session, we're going to explore more about those barriers, but also highlight some success stories and innovation solutions that are expanding access to veterinary vaccines. But first, we want to turn the spotlight to you.
Exactly, Dan. You are the ones on the ground. You are the ones helping making decisions. You are the one fighting the disease for your territories, your communities, and your people. And we want to know and hear about you right here, right now. So that's why I'm honored to invite you to answer to this, exactly this QR code. This is a Mentimeter so that you can answer a question here with us in this exact moment. Don't worry, this is a quick question, is designed for make you reflect, or in veterinary terms, make you ruminate a bit more. This is anonymous, so feel free to answer these questions. Every one of you, also in the mezzanine.
Yep. And the question is, in your opinion, what do you consider is the biggest obstacle that is impeding vaccine availability? Option A, inadequate WOAH standards. Option 2, access to pathogen field trains. Or option 3, insufficient funding for research and development. Let's give you a couple more seconds to answer the question.
And thank you for all the likes that are happening right now. You can also answer the question if you're connected online. We have 176 persons on this Mentimeter.
That number keeps growing and growing. We'll make 300, let's see.
Well done. I think we have a clear majority in the answers.
Yep, I think it's clear. Option 3, insufficient funding for research and development. And I'm sure our rapporteurs will delve more into this as we go into our next session. So now we're going to play a short video and revisit our fictional member of Noroland to see where this disease outbreak story has progressed. Let's listen.
We're here with a pharmaceutical executive. Why is vaccine production so challenging?
Vaccine production is a long and careful process in which we develop vaccines based on the circulatory strain. This vaccine should protect animal without any harm. That's why we must ensure safety, effectiveness, and regulatory compliances, which makes this process a bit challenging.
We saw COVID vaccines were developed quickly. Now, in veterinary medicine, how long does it typically take to produce and distribute enough vaccines in an emergency like this?
It depends on the disease, because in many cases, vaccines take several years to develop. Even if we have existing formula, ramping up production quickly is a major logistical challenge.
So even if authorities decide to vaccinate, can they get the vaccines fast enough?
Not always, because it depends what kind of vaccines are required. It's a new vaccine or the modification of the existing vaccine. That's why preparedness and early investment in vaccine research are so critical, especially when we are racing against the time. I would like to mention 2 more points. We need to facilitate quick access to the circulatory strain for quick production and reducing unnecessary administrative burden to fasten vaccine development and its deployment in field for a greater impact.
Well, I'm glad we have the correct experts today with us to answer and to solve this problem. Now we will take this reflection even further. I have the pleasure to invite Dr. Donadeo to the stage. She will guide us through the next part of the session, along with the experts joining us for this technical session number 2.
Thank you very much, Marianne. Can we have the slides, please? Okay, so now we're going to talk about the bridging gaps to enhance vaccine availability. So we are going to talk about the first component of the graph that by the end of the forum you will be tired of it or you will know it by heart, but we're going to talk about vaccine availability. And what do we mean with vaccine availability? We mean that effective and safe vaccines exist, that they are produced at large scale, and they are purchasable on the market. We mean that vaccines conform national and international quality standards and fit for purpose exist. So with vaccine availability, we are referring to the product itself, to the vaccine itself, that it exists. And some of the challenges that we want to focus, we are talking about 4 in this section, is about the target product profiles. Batty already mentioned them. So these are documents that usually are in a table format, and they describe the characteristics, the ideal and the minimum characteristics, depending on the objective of the vaccine. If I want to eliminate, if I want to control, so then we know exactly, especially for research and development, what type of vaccines are needed. Not to mention African swine fever as an example could benefit from a good target product profile. Another thing is vaccines in aquaculture. As Batty mentioned, they are mentioned in the manual, but they are not in detail. And we really believe that there's an opportunity to include the requirements in detail. And also, we are going to do TPPs, if we convince you to do TPPs for the terrestrial manual, also for the aquatic vaccines. Regarding vaccine innovations and updates, we know how there's a big delay normally from the development to be implemented in the vaccine. And we need to shorten these times. And one of the challenges is the Nagoya Protocol, that it has very commendable objectives. What they want to do is very commendable, but it poses logistic challenge. So let's see what can we do to overcome these challenges, how we can make it easy to implement. And then lastly, about vaccine production, there are different types of vaccine production. As Batty said, not every country needs to produce their own vaccine. We need to look at what's best at partnerships, regional partnerships, public-private partnerships, etc. We need to find the right mechanisms. So in order to discuss more about these topics, I would like to invite Professor Anne Cullinan. Professor Cullinan is the Vice Chair of the WOAH Biological Standards Commission, and she will provide a short introduction on the WOAH standards concerning vaccines and will lead this session. Anne, please. Thank you very much, Anne. Did you have a slide? This one.
Well, good morning, everybody. I've been asked to give a very quick overview of the WOAH standards in relation to vaccines, and I see that 20 of you voted that the WOAH standards, problems with the adequacy of the WOAH standards in the poll that we've just run. So the WOAH standards are science-based, and they're established through a democratic and transparent process. And once that has been performed, they're published in either the manuals or the codes. So when we look at our terrestrial manual, we actually have 5 chapters that relate to vaccines. One of these is a kind of overarching chapter on the principles of veterinary vaccine production. And 3 additional chapters then all deal in more detail with manufacture and quality standards. We also have a chapter that relates to the application of biotechnology in the development of vaccines, and that is currently under extensive review. When you go through the manual, the disease-specific chapters have a diagnostic section and then a vaccine section. And in the diagnostic section, we cover what tests are recommended for monitoring the immune response to vaccines. And then in the vaccine section, for that particular pathogen, it covers the appropriate safety, efficacy trials that should be performed. In the terrestrial code, there's an excellent chapter for 0.18, which gives guidance on the design and implementation of a vaccination program, different vaccination strategies depending on the epidemiological situation and the reason for vaccinating, the choice of the vaccine, the logistics, which can often be a problem, and then very importantly, the monitoring and evaluation of the efficacy of that vaccination program, and then, if necessary, the factors that should be considered in an exit strategy. There's also specific advice in the different disease chapters relating to surveillance, eradication, and the international movement of vaccinated animals. And then, of course, there's the excellent resource of all the WOAH reference laboratories around the world, which are, each of them is in the hands of a recognized international expert, and it is part of their remit that they are there to advise the members on how to use the vaccines, comparative vaccinology, what vaccines might be in the pipeline, and different evidence-based vaccination regimes. There are also the WOAH collaborating centres, and some of these focus on vaccine evaluation and on complementary activities such as surveillance and modelling. So that's what exists, but we're here today to see how we can move forward and solve some of the problems with vaccine availability. So I'd like to take the opportunity now to welcome our expert panel. First of all, we have Dr. Bernadette Abela. She works in the global program for neglected tropical diseases at the World Health Organization, focusing on zoonoses. We have Dr. Carlos Orellano Baquera. He is head of veterinary services and the WOAH Delegate of Chile. He's also the current vice president of the Commission of the Americas. Dr. Donald King is a member of the WOAH Biological Standards Commission, and he heads the WOAH reference laboratories for foot and mouth and swine vesicular disease at the Pirbright Institute in the United Kingdom. Then Dr. Carolyn Shoemaker. She is the CEO of GalvMed, which works to improve veterinary vaccine availability and access throughout the Global South. So we're very honored to have such an erudite panel, and each of the speakers is going to put into context some key aspects affecting vaccine availability. And we will start with Dr. Bernadette Abela, who is going to explain about target product profiles. Thank you, Bernadette.
Good morning, everybody. It's a great pleasure to be here at the General Assembly. I'm a veterinarian, so it's sort of coming home. So today we'll just cover a little bit what WHO does with regard to what are target product profiles and why we use them. We've just heard that there's a diversity of communities that need these vaccines, and so there's also a diversity of the tools that we need to develop. And so target product profiles for WHO is really a way of designing the product that is fit for purpose. So the private sector looks at it more as a strategic guide for development of a certain tool, a vaccine in this case. WHO really puts public health as the goal for the target product profile, and we're basing the design of a product that we need that is fit for purpose, and we base it on a use case. So just a quick example, if you're talking about your end user being very far from the capital, there is no cold chain, trying to design a product that is going to reach that last mile to those populations and also available at either a cost that is affordable or as a public good. So again, just to take home message on this slide is WHO's TPP really is to meet a public health need. And WHO has different programs, so these products need to fulfill, for example, an elimination target or an eradication target. And so the tools will specify the target that we are trying to reach. And so it's not only about the technical product and the technology to build that product, it's really about a collaborative decision that looks at the end-to-end strategy, from the R&D all the way to proof of concept, production, and then implementation. And it's a collaborative design that looks at these different use cases. It's built based on consensus and looks at the perfect tool based on needs and preferences of the different users, the communities, the stakeholders in general. We also go out for public comment, so it's not really designed for a specific expert group to provide input towards, but is really open to the public to get as much input as possible and to have the best design for the final product. Doesn't mean we get the perfect product at the end, but at least we have a standard that we provide as a public good to the manufacturers, to the researchers as a guide. And you can find a lot of these TPPs online. We have a website, and really target product profiles are there to allow for the recognition of access, equity, that it's reaching the right people, the right communities, that it's affordable, and is really, the target product profiles are really an integrated sort of baseline to the development process of the tools that we need in public health. Thank you very much.
Thank you very much, Dr. Abela. It's very interesting to learn from human health and to see such a collaborative approach. The next speaker is Dr. Becerro, and he is going to discuss the use of vaccines in aquaculture.
Muy buenos días a todos y a todas. Mi presentación va a ser...
Good morning to all of you. I'll make my presentation in Spanish, but before I make this presentation, I'd like to thank WOAH for organizing such a debate on complex matters that require complex responses. We can't hide away and we can't shy away from this very difficult topic. I will paraphrase Hamlet, because if Hamlet was a vet in the 21st century, and if he was attending this meeting today, his question would be a head of department or not to be a head of department? Because we had a meeting, we have meetings with producers, and this was a quiet meeting as compared to the ones that we usually have. So as heads of department, we're faced with many dilemmas. And one of these dilemmas is to vaccinate or not to vaccinate, to trade or not to trade. So yes, it is a complex issue. So, the importance of vaccination. I'm going to tell you about our experience in Chile about vaccination in fish farming. Vaccines allow our fish to be in better health, but we've seen that vaccines play a very important role because they help limiting the use of antimicrobial drugs, and therefore they limit resistance to antimicrobial drugs. Hence the importance of using vaccines. As we all know, there are vaccines that treat bacterial diseases, others for viral diseases, and the complexity in the field of aquaculture is linked to the way we administer vaccines, because that's different in fish as compared to terrestrial animals. So we mostly use self-vaccination. And I'd like to focus on this because vet authorities are faced with a challenge, which is that of making vaccines available to farmers, or fish farmers, when they need it. And we also need to make sure that these vaccines are efficient and safe. In the previous panel discussions, we talked about the differences between the code for terrestrial animals and the code for aquatic animals. And we talked about making headways to make sure that vaccines are efficient. But we also believe that these requirements need to comply with the reality in each country and to the experience in each country. We had traditional vaccines, and therefore we need instruments to make it easier to have these vaccines available in a harmonized manner. So, we need standards. We need standards to help us make decisions as official vet authorities. And why is this important for Chile? And why did I say that this was a complex system? Well, because in our country, Chile, it is even more complex. For instance, in charge of terrestrial animals, and to make things even more complex in this Shakespearean nightmare, there is another part of the vet services in charge of aquatic animals, and this is the National Fisheries Authority. So we need to be organized with full transparency. We need to communicate, and it's not always easy because it has to do with personal contacts and personal relationships. Okay, some people wave at me, telling me I no longer have time. So allow me to conclude and say that what matters is science. First and foremost, science and research, and a good coordination between the private and the public sector, a good partnership to ensure the success of our fight against diseases. Thank you.
For highlighting the need for standards in such an important industry. So our next speaker is Dr. Dawn King from Purebright, who is going to tell us all about the complexity of the Nagoya Protocol.
Yeah, good morning, colleagues, and thank you, Anne, for the introduction. I also have strict instructions to keep to time, so I will try to say something in a few minutes about the Nagoya Protocol to raise awareness, I think, amongst colleagues here about the undesirable and perhaps unintended consequences of this protocol as it's used today, or perhaps will be used in the future. So the Nagoya Protocol is an international treaty that governs access to genetic resources, and the agreement underpins the fair an equitable sharing of benefits from the utilization of these materials. And the concept within the protocol is something called genetic sovereignty, which means that where material is collected, where samples are isolated perhaps from clinically affected animals, that's the country from which the ownership and subsequent utilization needs to be negotiated. Perhaps a complicating factor of the Nagoya Protocol is that what's called the ABS guidelines, or the access and benefit sharing that associated with these materials, is usually defined by national legislation. And this, of course, sometimes can be inconsistent and sometimes raises a lot of complications with the implementation of the protocol. So I think we recognize that the guidelines and motivation for this protocol are very laudable, and of course it encourages bioconservation, but certainly for a disease such as foot and mouth disease, which I work with, there are significant challenges with the implementation of this disease for the development of tools. And so this was work that we have discussed within our FMD reference laboratory network, and with colleagues at EUFMD have looked to try to raise awareness of these unintended benefits. And so what I have is really sort of two case studies. One is looking at the work that we do as reference laboratories, which falls perhaps slightly outside of the main thrust of the discussions today, but I think these are quite important messages. And then a second case study which relates specifically to the development of tailored tools. And so I think we know and all familiar with the idea that global surveillance of transboundary diseases is often reliant on the shipment of samples to testing centers to undertake analysis of those samples. But of course, when samples are sent to international reference laboratories for this testing, there's a disconnect with the agencies that oversee the Nagoya Protocol. And so the Nagoya Protocol is normally managed through a government body called the Nagoya Focal Points, and they are divorced from the Ministries of Agriculture or Ministries of Veterinary Sciences that are represented here today. And so typically samples that are received for diagnosis and characterization purposes do not normally consider the requirements of the Nagoya Protocol. And I think a key message perhaps for the work that we do together for international surveillance is we need to make sure that the implementation of the Nagoya Protocol doesn't disrupt in these surveillance activities. Thinking specifically about the development of tools, and here today we're talking about specific vaccines that might be developed. I think we've already heard from the presentations earlier today that updating vaccines, making sure that those vaccines are well matched to circulating strains, is reliant on accessing material from recent outbreaks. And so clearly, hopefully there's no disagreement that vaccine companies and diagnostic companies need to access contemporary strains to update these tools. And this is obviously a global good, but also a commercial activity. And my understanding in discussions with companies is most companies want to engage with the national Nagoya focal points, but they have difficulties doing so, and they have difficulties reaching agreements that are mutually acceptable. And failure to develop these responsive pipelines to comply with the Nagoya Protocol may have long-term consequences, which I think all of us in the room perhaps would not be very happy about, and including the reduced availability of vaccines, the breakdown of these international partnerships, and sometimes even the withdrawal of pharmaceutical companies from the sector, the veterinary sector, to make new vaccines. So further, this is just a very short introduction. If you want more information about the focus of the Nagoya Protocol on the work of the Foot and Mouth Disease Reference Laboratory Network, we published a short review paper about a year ago that highlighted some of these issues. But I think, in a sense, I have perhaps two questions to pose to you. One is linking to this work of the reference laboratories and the work that we do for global surveillance. Do we all agree that routine testing of field samples by international reference laboratories should not be constrained by the Nagoya Protocol? And that idea of just characterizing material, you're not utilizing the material, you're just defining the status of the material, is whether or not that should be part of Nagoya. And that would be a very helpful position, I think. And then the second issue is, of course, recognizing that reference laboratories often need to access these materials. How can we ensure that the potentially disruptive impacts of the Nagoya Protocol are minimized? And here, I think today we will not necessarily come up with a solution, but I think here we start perhaps some discussion on this topic. I thank you for your attention.
Thank you very much, Don, and especially for keeping to time when it's such a complex issue that really merits a lot of discussion. Now I'd like to give the floor to Dr. Schumacher, who is going to talk about vaccine development prioritization and resource mobilization for veterinary vaccines development.
Thank you so much, and good morning to all. Very pleased to be here. So it is my pleasure to take you, it's the green button, right? Yeah, okay. So it is my pleasure to try to shed a little bit of light into this question of vaccine availability, because it is a complex issue, and obviously if you don't have the specifics, you cannot target the solution. We at the Global Alliance for Livestock Veterinary Medicines have recently done a study in a multitude of African and Asian countries looking at the availability of pharmaceuticals and of vaccines in different species, in different production systems. And this is just a very, very small shot concerning small ruminant vaccines. You can probably guess what they are on the bottom and see the countries. What I would like to highlight here is just that the study has revealed that the situation is highly variable and definitely insufficient to sustain preventative control efforts or even control efforts. Nevertheless, there are a couple of specifics, and they need to be looked at when you try to find a solution. So, for example, vaccines are much more scarce than are pharmaceuticals. In poultry, you have more vaccines than you do have in ruminants. Commercial farmers have better access to vaccines than small-scale livestock producers, backyard farmers, or even pastoralists. There's more vaccine available in peri-urban than in rural areas. It is better in some countries, and it definitely is better for endemic diseases than for epidemic diseases. Now, when you look a little bit more into this, and you want to understand, well, what are the main barriers for availability of vaccines? Before I go there, the industry and the academic sector clearly sees a much reduced funding environment for livestock vaccines, and that is really independent on where you are. But the gravity of impact increases as you move to the southern hemisphere. And so that alone is a huge barrier, but I won't speak about this for now. What I want to look at is when you put yourself into the farmer or the veterinarian or the government position, what are the barriers they consider the most important one? It's quite interesting because when you look at the graph, really the most important barrier is regulatory affairs. Because without registered quality products, well, there is nothing you can do. And so that is the first and most severe one that is evaluated, that is identified by those asked. You then have policy restrictions, and that affects particularly the ruminant sector. The poultry sector is much more liberal, and particularly the private sector is allowed to play in a much more commercial manner, and so it facilitates access to vaccines. The last one I would like to mention, which is significant, which is the low awareness of diseases and of the solution of vaccination in farmers, which has a direct impact on the demand. Without knowledge, without understanding the benefits of vaccination, there is no demand, and without demand, there definitely is no supply. Without supply, there is no innovation. Now, what does it need? What do we need to, go on further? When we look at availability, what I'm trying to emphasize here is that you really have to look at the entire value chain of vaccines, and starting with vaccine development in the academic sector, but then also looking into the vaccine development in the commercial sector, because that is ultimately what brings a product to market. In view that there is there's few research money available, the research efforts need to be focused, and particularly where, on priority diseases and where no solution is available. Product development is facilitated through product development collaborations such as ours. They need to respond to the country's needs. We need to facilitate registration. In the country, we need to identify and lift business barriers, build a vibrant veterinary service provision profession so that they can reach farmers, and finally, do whatever is needed to advocate for vaccination to stimulate demand. And that obviously requires that all players play together. Thank you so much.
Thank you very much, Dr. Schumacher, for emphasizing how we need a sustainable market, really, to preserve vaccine availability. And to all the panelists for their contributions, which really set the scene for a good discussion. So my first question is, I'll start with you, Dr. Abela. What do you think is the reason for today's lack of vaccine availability?
Thank you. It's a complex question, but I'll try to answer it in a short way. So we just heard about demand being a key, key thing that we need for generating the tool we need. But actually, often the need is not identified. We don't have the data to substantiate the need. And so for the diseases that I work on, for example, on the endemic neglected tropical diseases, we often miss that puzzle, piece of the puzzle, and often these diseases are not prioritized. So what I want to bring up is it's not always a tool with a commercial value that starts the momentum for the development of a new tool. And so we need to be thinking the end-to-end strategy where we're looking at, as we start with a TPP, but thinking of where it's going to reach. We work with very diverse communities. Some can pay, some cannot pay. How do we deal with the development of a tool that might not be going into the production sector that is high output? So the farmers we work with are unable to pay for vaccine. And so it will be a different type of strategy we need for developing those type of vaccines that, focus on the population in need. So I guess what I'm trying to say is to avoid market failures of vaccines like for the endemic diseases, we need to be looking at those target product profiles very carefully, because vaccine research and development costs money. It takes about 10 years to do. About 300 million go into research and to development until it reaches the market. And so we need to be really clear so that we do have the tools we need, where we need them, and for the communities we need them for.
Thank you very much for that. Dr. King, would you like to give us your views on this, and also maybe a little bit about the lack of development or the application of technology to the animal health vaccine sector as opposed to the human health?
Yeah, perhaps just try to say a few words on this, and I suppose just to expand on the points made by Bernadette already, which is, of course, producing new vaccines requires a long-term investment. You need to build new facilities, new plants, and new investment. And I guess, you know, one key area that we talked about yesterday was having certainty for the commercial sector to enter into these markets and to put the investment in place. And I think perhaps where we are at the moment is certainly, you know, I work a lot on foot and mouth disease. We see globally that there is not enough vaccine produced to meet the demands of the customers. So clearly we need to spend more effort in this space to put more resources so that more plants and more companies can enter this sector. In my presentation, I perhaps highlighted one key area, which is this area of commercialization and perhaps this always slightly uncomfortable idea that people are making a profit from producing veterinary vaccines. I think we need to have some good discussions in this space to make sure that the commercial companies are welcomed into this space and that they are able to make a profit, a comfortable profit from this. But at the same time, I think even yesterday and earlier today, we heard also some of the concerns of countries, low and middle income countries, which perhaps would like to see more wider benefits from the technologies when they're implemented to develop new tools. So I think that's something that's a topic perhaps that it would be good to see WOAH take more, perhaps put more attention to, perhaps focusing specifically on this ABS legislation relying to the Nagoya Protocol. The other point I was going to make, which is perhaps representing here the reference laboratories, of course, another key area that is perhaps sometimes missing is good quality evidence to demonstrate that vaccines, when they're used, are good quality products and actually efficacious in the animals when they're vaccinated. And I think, again, it's sometimes quite difficult to find that evidence. It's either published in literature and put away somewhere where it's not clearly seen. And I think perhaps this initiative that's going to raise the profile of the TPP, the target product profile for vaccines, and so that customers can actually question the extent to which these vaccines meet those criteria and make much more confident decisions about whether or not vaccines, when they purchase, when they invest in these vaccines, are likely to be meeting their requirements in the field. And I think that's an area that certainly we discuss for FMD, and I think it's probably true for other diseases that there's still a gap, and we need to work towards filling that gap. Thank you.
Thank you for that. I think that's a really excellent point, and it kind of marries nicely with Bernadette's emphasis on vaccines for particular use. And then I totally agree that we should be evaluating the vaccines independently in the field to see if they meet the requirements. Dr. Baquero, will you give us your insights, please, particularly into the aquaculture side and what you think are the major issues relating to vaccine availability and the application of new technologies to vaccine development in this area?
I believe that, as was said here before, I believe that there is limited availability of evidence and data. Then, if we have access to the strains which are in circulation, that could be very good. And third, how do we articulate offer and demand? Because we talked about the commercial aspects of things, and there are companies that are going to work in R&D, but they will do that only if there is clear demand. And then we also talked about how difficult it is to work around certain regulation and regulatory frameworks. We see that for terrestrial animals, criteria for vaccines are more developed than they would be for the fish farming industry. So maybe we need to work a bit on this. And then I cannot avoid talking and quoting Shakespeare again. And the dilemma for us is to vaccinate or to trade. Because how can anybody make a long-term decision if the decision to vaccinate depends on the decision to ban trade by certain partners?
About regulation, harmonization of regulation, and the concerns of how vaccination will impact trade. Dr. Schumacher, can we ask you, what lessons can we draw from the human health sector?
That's a very interesting question, because already the first lesson is that we're dealing with many, many species and not just one. And that makes the task in hand obviously even harder. We also don't have the same means that are put into organizing mechanisms like Gavi or into campaigns combating childhood mortality and so on. So we are in a very, very diversified environment. And in this diversified environment, we have really no choice than to be specific to us, to try to target what is most critical, what is most important. Only if we orient our scarce resources towards what's relevant and what makes a vital difference can we actually make progress in controlling and particularly preventing diseases. Because right now, prevention is high on the agenda in the human health sector, but it is really not yet where we need to be in the animal health environment. There is another aspect, and that is in the human health context, we deal with patients. And there is a lot of respect for the individual, whereas in the animal kingdom, we talk about diseases, we talk about species. Very rarely do we talk about the owners of the animals. And I think it is absolutely critical that we start putting the farmer into the center of the discussion and we associate the farmer to the discussion. Much of the dilemma veterinary services have, particularly in the ruminant sector, is due to the fact that the responsibility for vaccination has been taken away from farmers. And we have to restore that responsibility and accountability of the farming community for the health of their animals. The good news is that in this context, whenever I go to a farm, since the 30 years I go to Africa, African farms, I have never met a farmer who, A, doesn't want to make money. I never have a farmer who doesn't want to keep healthy animals. And I never have a farmer who refuses to pay the price for medication that he knows will work, which is where quality comes in.
And could I ask you, how do you think we can mobilize investment into vaccine development? There are so many publications of work done in academic institutions where people are looking at the latest technology, doing a pilot experiment that it works in animals, and yet it's never produced. How do we mobilize investment?
So first of all, to the defense of academia, they are absolutely critical because they are the source of new technologies, of new ideas. They are actually the reservoir that the industry goes to select new technologies. For example, right now in our context, we are looking at all of the COVID technologies, and that has been 20 years of academic research. So let's not throw the academic sector under the bus by any means. Nevertheless, when it comes to, if the sought solution is a product, you will have to work with the commercial sector. That is their job, that is their competency. The money they make will be reinvested into enabling the diversification of a portfolio, the continued evolution of a portfolio, and then obviously also all the commercialization efforts. But they cannot work alone. It is time that we reach over the divide and really try to work together, because on both sides and all sides there is passionate professionals with good knowledge, with a particular approach, and we could just stimulate each other. Just to finish this, I know my time is up, but there are actually quite a few innovative funding mechanisms out there. You know, you will hear later from one of the ones that we are involved in, which is the AgResults competition, which means that you pay for results, you don't pay for effort. One of the things we need to start doing is really say, give the job of doing products to the industry and pay for the result and not the effort. And if you look into the human sector, to come back to, you know, what can we learn, there is a number of mechanisms out there that we can also learn from.
Okay, thank you very much. Dr. Abela, do you want to contribute on this about the human health sector and what we can learn?
Thank you very much. And I just want to re-emphasize, I guess, what Caroline said was, I mean, we do need partnerships. We need the private public sector coming in with us. WHO, for example, works with Gavi that provides funding. We work with CEPI that provides sort of the research and design around products. We work with UNICEF to help us build demand, to help us the education of communities, to mobilize communities. So it's really about a partnership. What we have also learned in the human health sector is integration, so that we can do multiple diseases at the same time. When we're going out to communities, then we need to be able to administer more than just one disease when we look at the immunization program. But we also allow health workers to be vaccinating our babies. And this is something that really increases our reach into communities, increases our population that can deliver the vaccine. So let's think about also the innovation about administration, oral vaccines for us, but we learn from the veterinary sector when we think about, the vaccines that are by droplets or whatever, we learn from them. But from the WHO, for example, when we look at the polio vaccination program, we have an easy vaccine, it's oral. So, it helps to use non-technical staff to actually deliver. Thank you.
A very good point. Now we have time, I understand, for one quick question from the audience, if anybody would like to address a question to the panel. Dear me, we've killed it. Okay, well, I don't see any volunteers, so could you please join me in acknowledging the contribution of the panel to And Batty will come now and give us a summary of our discussions. Thank you very much.
Thank you very much. And this was quite fascinating. Thanks a lot for I hope I'll do justice in summarizing what you said. On the TPP, we heard that from WHO, that TPP based on intended use are generated through a consultative process and made publicly available. So I think this is really could be beneficial for the animal sector also to consider a similar process. I'm sure we'll discuss that further. On the aquaculture, it's the importance and increasing role of vaccine in reducing environmental challenge, decreasing AMR, and disease outbreak in aquaculture. Therefore, it is important that they are included in the aquatic manual, and also hopefully also the TPPs are also developed for aquatic vaccines. And then on the Nagoya Protocol, covered already, the Nagoya Protocol, WOAH and member countries should promote appropriate implementation of the Nagoya Protocol. We heard from Don that this should include development of technical guidance, access protocol, and national legislation. Hopefully it will assist. And then from Caroline, we heard, especially toward the end, I think clearly that efficient and effective product development partnerships are critical. And different mechanisms should be explored for technology transfer, mechanism to incentivize transitional science. I think that's really quite a strong point that was made toward the end. Thank you very much. Thank you.
Thank you.
Well, once, thank you. I guess so. Our moderator would.
Moderators are coming. Well, thank you very much.
Yes, thank you very much, Dr. Dungo, for that excellent summary of this very insightful panel discussion. And a profound thanks to this panel of experts and our excellent chair. We have clearly saw how vaccine development and production come with many challenges. And it doesn't stop there. Once a vaccine exists, there's still barriers to overcome. So after the break, we will be trotting over to our next topic, into registration and the access to vaccines. Because even the best vaccine is like a horse without a saddle if it can't get to where it's needed. Marianne, did you write these jokes, all these animal jokes in here?
Sorry. Well, yes, I think we all deserve a break, so see you back here at 2:30 sharp to continue with this discussion. But before you stand up, we would like to invite you to visit our kiosk, go to your meetings, and to our side event. During this break, you can go and follow with the results of the Mentimeter to the meeting that is called How Veterinary Science Can Access World Bank Financing in room 262. And your side event, Dan is also a multitasker here.
Thanks, Mariana. There's a side event called Strengthening Emergency Response, Harnessing Incident Management Systems for Animal Health. That is starting at 11:15 in room 251.
We have more. After that, we have another side event entitled The Journey Towards the Eradication of Peste de Petits Ruminants, also in room 262, but a bit later. And the last one, Dan.
Yep, antimicrobial resistance in companion animals, why it matters. That's starting at 12:45 p.m. till 2 p.m. in room 251. So please make sure to get to these side events early as space is limited. So please enjoy the side events, enjoy visiting the kiosks, and enjoy your lunch. We'll see you back here at 2:30 p.m. Thank you.
ça c'est fait. Ouais, j'arrive.
Là à côté là, du RIAL.
Ah bah, putain, ils l'ont viré. Je sais pas si on doit le remettre. Regarde, ça fait vilain quoi. C'était plus joli en...
Ah non, mais il n'était pas autant bougé.
Ah, on est d'accord. Hein.
Quelqu'un...
Voilà.
dans
No me lo merezco, no me lo merezco.
capteur, c'est pas lui qui a le premier plan, parce qu'on l'aura vu, en fait on l'aura beaucoup vu juste avant, vu qu'il y a toute une partie documentaire au début. Donc je me suis dit, sinon ça fait un peu film sur lui, et en l'occurrence c'est pas film sur lui, c'est vraiment film sur le document. Alors là, en vrai, c'est pour ça que j'ai envoyé un mail à Gauthier cette semaine, pour qu'il me renvoie tout le début, toute la fin, parce que c'est ce que... Mais il me semble qu'on en avait parlé déjà, je t'avais dit, oui effectivement c'est pas lui qui a le premier plan, mais il y a toute l'entrée où il va marcher entre les sièges, on le voit. Bah oui. Ah mais tout ça on l'a bien sûr. On a les applaudissements.
gentlemen, please take your seats. The general session will start in 1 minute. Mesdames et messieurs, la session générale répondra dans 1 minute. Nous vous prions de bien vouloir regagner vos places. Merci. Good afternoon, ladies and gentlemen, and welcome back. Please take your seats. Thank you. We will now start with technical session 3, the third session of our Animal Health Forum, entitled Overcoming Barriers to Ensure Timely Access to Quality Vaccines. Now, I hope you all had a nice lunch, you enjoyed the kiosk, you enjoyed the side events, and you got to connect with old colleagues and new colleagues. But I've noticed that I'm missing my partner, actually. Has anyone seen Mariana? Mariana, are you there? Are you up in the mezzanine, by any chance?
Oh, I'm here. I'm so sorry. I was in the gift shop.
You were shopping?
No, look, I have this for you. Perfect for shoes.
Okay.
We have a mug. Don't drop it.
Thank you.
Look at this. Ooh, water bottle. It's fantastic. This is for me, but get it. I saw that it might rain. That's for you.
Oh, thank you.
And of course, thank you for being on time, because I haven't forgot about you. So please then help me with this. Oh no, I have something more. I have something more for them. But don't ask me how you say this in English.
What's that?
This is for your kilt, and it's called gemelos, and they are wonderful. So
it's
this
cufflinks.
is...
Oh.
How?
Cufflinks.
Cufflinks, thank you.
Oh, thank you.
1 and 2.
Did you leave anything for our guest, Mariana?
Oh yeah, you can go to the gift shop in the hall number 28, that is just next to the door, the main entrance. Oop. And we have something for you. Thank you for being on time. And the first one is this lovely fish. It's a squishy fish. And I want to give it to someone who dedicate their job to aquatic animal health. Sorry.
Oh.
Excuse me. You have more. You will have more. So take this too.
Oh, thank you. Got a fish. I never thought I'd be throwing fishies at the World Assembly, but there we go. Who wants a fish? Ready? Sorry if I hit anyone. There we go.
I think for this side, they deserve a sheep. Someone wants a sheep? Yes? I'm not going to see. We have been rehearsing this, so... Woo!
Well done.
Yeah, somewhere.
And I have a hippo, and I'm not going to even try and throw it up there on the mezzanine. I'm sorry. I'm going to hit a light or
We
hit someone in
tried,
the head.
but you're too far.
Maybe over here. Go. No, I'm going to... Shall I try?
Oh.
No. Maybe someone over here. There we go. And now, just a quick bit of housekeeping before we go any further. Some of you may have received an email, delegates, you might have received an email about the quorum. Just to note that we have not reached the quorum for the early adoption of several resolutions through the UK Engage Platform 1. Now, today is the last day for delegates with voting rights to cast votes through the online platform. So to cast your vote, please log into the delegate portal, and under the 90-second general section, a link will be displayed for online voting. Please cast your vote as soon as possible before this evening. Now, if you have any trouble accessing this link, please visit our IT help desk, which is just outside in the foyer behind the doors here. Thank you.
And now, let's go back to business. Vaccine registration is this first afternoon technical session, number 3. So, vaccine registration is fragmented and is different between regions and between countries. Licenses often follows the demand. So, when registration or procurement is delayed, also the access becomes a problem. Without mutual recognition system, vaccine availability can be slower. So, leaving countries to rely in lower quality vaccines or even antimicrobials. Tools like vaccine banks or pre-qualification can help speed up the access to safe and effective vaccines. In this section, we will look at the main challenges and explore mechanisms that support faster national procurement and better access to vaccines.
And as for the previous session, you will now see a QR code appearing on the screen, which you can scan to answer the following question. So please use your phone, point it at the QR code. So the question is, do you believe that your current vaccine registration system enables timely access to high-quality vaccines to respond to animal health emergencies? Yes or no?
Ooh. Oh. Almost half-half.
Yep, 50-50. Oh, which way is it going to swing?
47, 50 answers.
Oh, wow. 50-50. Oh.
Please remember that the ones that are attending online are also welcome to vote. The registration systems enable timely access to high-quality vaccines to respond to animal health emergencies.
We're moving more towards the yes.
Voting.
And lots of likes coming through as well. Thank you for that. We appreciate it.
So we wait until 110 votes?
Yeah.
Okay.
One more to go. There we go.
Good. Thank you very much for participating in this Mentimeter and playing with us. So, and what is happening in Norland, our WOAH member? So let's see if the registration system enables timely access to high-quality vaccine in Norland. Let's keep watching the video.
Even when a vaccine is available, getting it to the farmers in need is another challenge. So why is vaccine access so complicated?
Well, there are several obstacles here. First, the vaccines need to be registered by the regulatory authorities before they can be distributed. And sometimes this process can be slow due to regulatory requirements, and this happens even during emergency situations. Then we have the issue of affordability. And for sure, some producers will struggle to pay for the doses they need. And then even if we have the vaccines, we need to ensure a supply chain. We need to have enough vaccines, but also the vaccinators to reach the affected population, especially in time.
And in the case of an outbreak, time is critical. So how do we speed up access?
Well, one option is having emergency vaccine banks, where we can have pre-approved vaccines that are stored, but that can be rapidly deployed. But later we have the coordination issue. It's not easy to coordinate the international and local responses. And at the same time, we need to ensure that we have the whole cold chain logistics in place. So this means that the vaccines have to be transported and stored at the right temperature. Finally, we also need the veterinary workforce to be able to carry out this vaccination. And imagine doing this in rural areas. This really means a challenge in some cases.
So our story in Noroland continues, and you saw some of the questions and the thoughts of the Chief Veterinary Officer with regards to rolling out the vaccines. And I do believe our Chief Veterinary Officer is sitting up there in the mezzanine. So if you have any questions for him, please do go see him later. And this time fits into our next session. So we welcome again to the stage Dr. Dungo, who will lead this session on vaccine availability. Dr. Dungo, please.
Good afternoon again. So we are going to continue with what we started in the morning. So now moving into the second box of our vaccine adoption. So the title being Overcoming Barriers to Ensure Timely Access to Quality Vaccine. So you remember again the graph, which we've been seeing since, since you got the paper. We're looking into access, which is the second box. It's not moving. Yeah. So, I don't know whether it went too fast, too far. Is it? Yeah, it's correct, yeah. So vaccine access, remember we say that all these concepts apply both to animal owners or farmers, but also to veterinary service. So access for an animal owner or a farmer or veterinary service can access vaccine because they are locally available. So by the concept of access, we're talking of not availability having been that the vaccine exists, but access is that it's there. They can access it. In French, you'll say disponible. So it is close by. So which means that either it has been registered, as we heard earlier, but also whether it has been authorized by veterinary services. We've seen cases of vaccines like avian influenza that can be registered, but they are not authorized by veterinary service. So those are two aspects that are extremely important to always know. So for farmers, then it means that they can procure it. Then it keep on. Yeah. So access, we discussed early this morning that there are two elements essentially. We were looking into the need for the vaccine to be registered, and we looked into the registration of minor use products, for example, for rabbits, as I said in the morning, and then limited markets, which could be the case of neglected zoonotic diseases, and then in case of emergency, which we saw in the video earlier. And then access also involves procurement. We spoke about forecast, and then mechanisms that exist to facilitate this process, being either pre-qualification, which we say that it's still being explored for use in veterinary, in animal health, although it hasn't been really extensively done. And then we have vaccine banks or vaccine strategic reserve, which has been implemented at different levels. So with that, it's a pleasure to call on the stage the panel that, with which we will be discussing these issues. We have first Dr. Teko Agbo Asiembo from the West African Economic and Monetary Union, ECOWAS, and he is also the head of the Veterinary Medicine Control Laboratory at the vet school in Dakar, and the WOAH Collaborating Center for the Center of Veterinary Drugs in Central and West Africa. Welcome, Dr. Teko. Our second panelist is Dr. Donald Samen, who is the Executive Secretary at the European Commission for the Control of Foot and Mouth, or EUFMD, based in Rome. Welcome. Our third panelist is Dr. Alastair King, who is the Executive Director of the International Veterinary Health Department at Merck Animal Health, one of the providers of the WOAH Vaccine Bank for rabies. Welcome. And then our fourth panelist is Ms. Alka Upadhyaya, who is the Secretary of the Department of Animal Husbandry and Dairying from the Government of India, and WOAH Delegates from India. Welcome, Doc. And then we have Dr. Charles Bojo, who is the Acting Director of the Pan-African Vaccine Center, or PANVAC, of the African Union, and Associate Professor at the Pan-African University for Life and Earth Science in Nigeria. Welcome. Thank you to our panelists for being here. We hope we'll have a great discussion. This session will be organized like the last one, where we'll ask each of you to give a short presentation. The first one will be from Dr. Teko. If you could talk about mutual recognition agreement. I think you have a presentation? Yeah, please. No? You just talk about it? Okay. I guess it will be in French. En français, ouais. Vous pouvez commencer alors dans ce cas.
Okay, so if you speak French, please do so, and your English colleagues will use the headphones. Thank you, Baptiste Dungu. I want to thank WOAH for inviting me. So I'm going to tell you a bit more about the registration programs for vaccines in our area and within the Monetary and Economic West African Union that brings together 8 countries: Benin, Burkina Faso, Guinea-Bissau, Niger, Mali, Senegal, and Togo. And the process in this zone experienced an historic evolution, and heads of states decided to move towards standardizing their veterinarian legislative framework. And that's historic, because before that, the situation was not so good. I mean drugs were used a bit everywhere with no safety. So we had to work on food safety, on drug safety, and on the safety of veterinary drugs. So animal health first. The Union established a list of diseases, reportable diseases, which is the same list for all 8 countries. And then some measures were taken that need to be enforced in case of an outbreak. And with regards to drug products, we made some tests, and now we have a centralized registration of all these vet products in the sub-region. So the basic principle is that no vet drug can be sold for free or for a fee without being authorized to be placed on the market. And we have a centralized system within our union. So it's just one license or authorization which is valid for the 8 countries. And the 8 countries recognize this marketing authorization, and this is how you can sell vet drugs to all farmers in our union. And this is how you can sell vaccines. Thank you so much, Doctor. And the system does work. It's been centralized for the registration, and it does work. We'll get back to you at a later stage.
As we mentioned earlier, you one of the few institutions in animal health that is probably the only one that has initiated or explored the pre-qualification system, which is well known on the human side. So maybe you can tell us in 2 minutes how you feel that it's something that one needs to explore.
Thanks, Patty. I'll do my best. We know that there's a problem with the use of substandard vaccines in animals. And yet today, we don't have an internationally recognized system to provide independent assurance that veterinary vaccines meet the minimum international standards in the WOAH manual. So pre-qualification speaks to that need. You yourself earlier, Bati, referred to a pre-qualification system that exists for human vaccines. And this was developed many years ago to support UNICEF in their vaccination campaigns against childhood illnesses. That has been operating for over 30 years. It has been highly successful, and it's very well regarded. So the body that I represent, EUFMD, borrowed from that model. We were asked by our member nations to address vaccine security issues, and one of those was to explore pre-qualification. So we borrowed from the WHO model, we adapted it for the veterinary domain, we applied it to veterinary vaccines, and we have demonstrated proof of concept. We've developed the processes and structures that can be used to pre-qualify veterinary vaccines, and we've published a short list of foot and mouth disease vaccines that have been shown to comply with the WOAH standard. So what next? Well, we are currently looking for partners to work with us to help us take that the next stage, to go from a pilot scheme to a fully operational and sustainable scheme. What we propose is that over the next 2 to 3 years, we extend this pilot scheme on a worldwide basis, we adapt the structures and processes accordingly, and that but we remain focused on foot and mouth disease vaccines in the first instance. We will work with national regulatory authorities for veterinary medicines. We will try to encourage vaccine manufacturers from across the world to apply, big or small, private or public. We will build in independent testing and inspection of premises, but in parallel and critically, because this is not about keeping anybody down, this is about raising standards. We will, in a completely separate process to the evaluation process, support those manufacturers who make an application and who encounter difficulties. And separately and importantly, we will look at a business model so that at the end of that process, we can hand over a system that is fully operational and is sustainable and can be applied to the pre-qualification of any veterinary vaccine or essential veterinary medicine that there's a need for.
Thank you, Donald. It looks like you've really worked it out fairly well, and it will be interesting to see how it evolves and eventually apply to other diseases. Thank you. And Dr. King, I'll move to you. You've been involved with the WOAH Vaccine Bank and similar systems. If you could
let us know how the system is facilitating access to high-quality vaccine to improve animal health.
Thank you, and thank you for inviting me to speak today. At its most basic level, the WOAH Bank means that there is a pool of vaccine, high-quality vaccine that's available for member countries to access. It's a very simple system. It helps us because it helps us know what the demand might be. I think, why would we want to be engaged with that? You need to look back a little bit further into some of the things that have already been discussed today. I'm often asked, what is your capacity to produce vaccine X? My reply to that is almost always going to be, what is your demand for vaccine X? Our manufacturing teams are planning for our production 5 years in advance. We're trying to juggle multiple products within a manufacturing plant at any time, so that's very hard to do. And when we get sudden demands, sudden requests, we can't suddenly drop all of the other products because those have roles to do as well. We can't have plants sitting idle, not doing anything. And there's been comments about cost of vaccines, affordable vaccines. I would point out that veterinary vaccines are about a 200th of the price of human vaccines. These are already affordable vaccines. But if we had sites just sitting empty, waiting for people to ask for vaccine, the cost of goods would go massively higher. Similarly, we can't just produce large volumes which sit on the shelf because they're going to expire. We're going to lose them. Again, that's going to drive the price up. So what is really key for us is forecasting. If we know what the demand is going to be and we have a stable demand over a period of time, then we can plan accordingly. We can make sure that the vaccines are available. We can put them in the right place at the right time. The banks allow us to do that. So something like the WOAH Bank, which is run, us talking to WOAH about what the needs are and understanding what the demands are, really works nicely for us. Because what we're able to do is say, okay, WOAH expect this amount of vaccine to be used through the bank. This is what they're asking for. This is what we're setting up for. So we're able to talk to our manufacturing teams for that. I mean, it's not just that bit. What we're then able to do is also start producing the vaccine, formulating and filling bottles. We leave a certain amount of the bottles sitting without any labels on, and then we label up other bottles. So the labeled up bottles are ready to go at a drop of a hat if someone has a problem. The unlabeled bottles will take a little bit longer, but if you need a special label on there because you've got special registration requirements or anything, then we can do that. And then we've got bulk that we're able to have as well. So the use of banks is really good for that management of these kind of problems. So when you're facing epidemics, even with endemics, when you may need sudden demand, using the WOAH Bank, we have other things that we do as well. A little while ago, we started working with Mission Rabies and the Center for Disease Control in the US, setting up the International Rabies Task Force. That's so we can actually talk to governments and get really accurate ideas of what's going on. And again, that comes back to the forecasting. So for us, this timely access mainly revolves around, give us the forecasting, and then we can do something about that.
Thank you very much. So you're talking really of not only vaccine bank, but also antigen bank, so bulk antigen that are stored a long time. That's great. So I'll move to India. Could you tell us about the country experience in terms of accessing vaccine for neglected tropical diseases and the impact in terms of quality is?
So thank you very much for this opportunity. And at the outset, I'd like to mention over here that India, like in the human vaccine or medicine side, is known as the pharmacy of the world. On the veterinary side also, India has shown its capabilities. Amongst the identified diseases which we take up as a national, under the National Vaccination Program, all vaccines are manufactured in India, which goes on to say that there is a robust R&D mechanism, there is a robust procurement mechanism, and the industry has a lot of comfort and support from the government, and we have support from them likewise. So today, as far as rabies is concerned, so India is the largest manufacturing unit, IIL, for rabies, and it supplies to various countries in the world. Similarly, in the sister cirrhosis, we are the first country in the world who have come up with this vaccine. Having said that, there will always be new diseases that will keep cropping up. We have a recent example of lumpy skin disease, where there was no vaccine, but quickly we turned around to the goatpox vaccine, and we started using goatpox vaccine. We got the recommendations, etc., from the regulatory body, and now India has produced its own lumpy skin disease vaccine itself. So the regulatory mechanism is something where most of the manufacturers get a little stuck on. So we have an empowered committee under the chairmanship of the CVO of the country who regularly monitors the progress therein. The committee meets every 1 month, or if required, every week. COVID, in fact, has taught all of us how to quickly turn around things. One last thing that I would mention over here, along with the experience of manufacturing, it's the cold chain which is very, very important. And this has to be seen in the right earnestness as well.
Thank you very much. And I remember that so far India is the only country producing the cysticercosis vaccine, which is really a neglected disease. And glad to hear that the regulatory system has been put in place for registering such vaccines. And then I'll come back to Africa with Dr. Bojo. Français ou français? Okay. Pouvez-vous nous parler du...
Can you speak about the role of your role as a collaborative center for WOAH to support access to quality vaccines in Africa mostly? Well, thank you very much, Dr. Bharti. I think that it's important to explain how this plan was actually rolled out. This plan was rolled out from our center because we experienced a lot of shortages at the time, and especially regarding the quality for rinderpest, quality of vaccines for rinderpest. Only 30% of the vaccines back in the 80s were of good quality, only 30%. So to sustain the Pan-African program against rinderpest, we set up the PanVac as an independent entity. PanVac does not produce vaccines, but it's an independent entity to certify veterinary vaccines in Africa. That is how from 30%, the African countries, thanks to the support of PanVac, were able to increase up to 82% to allow for the eradication of rinderpest in Africa. And most of these vaccines were produced, all the vaccines used for the eradication of rinderpest came from African countries. So it's important to stress this. So today the question is, how can we ensure access to quality vaccines to control diseases? So PanVac, as part of its program, was appointed by member states, and it's now a technical office for Africa, which role is to certify independently the quality of the vaccines, and we export and import. All vaccines that are imported have to be reviewed by the PanVac in order to get certified and then to be registered on the continent. So generally, we publish all the vaccines that we certify on the internet website, and I strongly recommend that you have a look at the PanVac internet website to view all the labs that produce vaccines and that send us vaccines for certification. And we are implementing a harmonized system for the registration of vaccines. And the next approval meeting, which will be held with national authorities for regulation and vaccines, will be in Dar es Salaam. And the goal of the meeting will be to approve the harmonized system for the vaccines and the vaccines registration, and also to set up a guide that will be recognized as a standard or label for auditing purposes and certification purposes of the industries that produce these vaccines. This will allow us to implement networks and recognize networks, minor labs, which have a well-acknowledged production system, and they may be used in case of emergency to produce quality vaccines. So that's our state of mind, to set up quality vaccines, because it's important to eradicate disease. We need to be able to use quality vaccines in order to build trust among farmers, to make sure that all animals are well protected. Thank you very much. So I'm going to move on now with you. Can you describe a situation where access to quality vaccines was an issue and the system that you presented earlier on was able to solve this issue? Can you detail this? Well, as I said earlier on, the best example is rinderpest. From 33% after the audit was carried out in 1983 until the end of the 90s, we were able to achieve 95% quality vaccines because PanVac, because of the training offer and because the harmonization of the quality control system among countries, we were able to improve the quality of the vaccines. Today, we've been working on the foot and mouth disease along with the Pibret Institute, and the idea is to set up a system of strain panels at local and regional levels. And this way, we'll be able to evaluate various vaccines per region. So at the moment in East Africa, we have a panel that allows us to adequately evaluate the foot and mouth vaccines. And we've also been working on a similar system for North Africa and East Africa also, and West Africa and Central Africa and Sub-Saharan Austral Africa. So that's our approach to continuously improve vaccines. And for the PPR vaccine, we've been working to set up a standard that will be subject to the WOAH approval for the evaluation, to develop the endpoint, evaluation endpoint for the based for thermo vaccines. So it's underway, and this will allow us to evaluate these vaccines and give better access to these vaccines on the market. I will continue in French with Dr. Teco. So we've talked about access to vaccines in case of emergencies for zoonotic, neglected zoonotic diseases, or for it's always a tough issue. How can we guarantee access to vaccines in emergency situations in case of neglected diseases? And what is the impact? How can we manage situations when we lack of registered and approved vaccines? And how could you lead to the use of forged vaccines or low quality vaccines? In cases of emergencies, we have specific provisions. In case of an epidemic, each member state is authorized to import vaccines without prior authorization. But then we obviously have to regulate and provide follow-up. There was a case with the hemorrhagic disease on rabbits. It emerged in Ivory Coast and Senegal, but the states were able to manage the situation, and they were then able to control the rabbits to better eradicate the disease. But now the main problem is that medication, like counterfeited medication and medicine, it's a real major issue in our sub-regions. There may be applicable regulations, but still there are some illegal, this illegal trade that sells counterfeited drugs, and that's a real issue. And therefore, we're asking WOAH for this specific project to actually set up provisions or guidance to recognize forged products. Last time, the products had been manufactured by the Central Laboratory of Bamako in Mali, and the product ended up on the market and had nothing to do with the original product. So they just tampered with the label. They put the market authorizations issued by the Commission. And so we try to evaluate every single case that they become so that quality products are available to breeders and efficacious products, but the trade system can prove to be problematic, as explained in this example. That's my answer to your question. Thank you.
To all panelists, I think based on what you presented, we can say that we understand that one solution may not fit all models, so on the basis of the model that you presented. So what do you think WOAH and our stakeholder can do in the next 2, 3 years to ensure that all members have access to high quality vaccines, taking into account the pre-qualification or the vaccine bank or in terms of neglected vaccines, vaccine to neglected diseases? Donald, I don't know whether you want to.
Well, I suppose at risk of repeating myself, Batty, we have developed a system that works. It's only been applied in limited scale. We think it should be supported. We call on delegates, international organization, industry to support us in that. That we believe that this system should be extended, that it is needed in the veterinary world. It works very well for human vaccines. And it's a system that could be developed in 2 or 3 years with the right willingness and a spirit of collaboration.
Thank you. And if we're talking just about the WOAH Bank, I would urge people to look at utilizing it more because it is underutilized. It's a fantastic service that's set up by WOAH. A lot of effort has been going into it. It's been running for a decade. It's very smooth, works nicely. So that's great. I would extend a bit further, however, because I was talking about forecasting and capacity. Public-private partnership and working together is really important. Veterinary medicine has managed to develop and deliver vaccines very quickly, not quite as quickly as COVID, but the blue tongue serotype 8 outbreak in Europe, we had a product in the market being used within 2 years of the first case. The reason we were able to do that was because we had good surveillance, we knew where the disease was, but most importantly, those governments in Western Europe had very open dialogue with us. They committed to buying certain volumes before we even got the vaccine fully created. They knew they were going to need it and use it, so they committed, so we were able to plan accordingly. We were then able to put a risk at our side of are we actually going to succeed or anything, but we had a guarantee at the end that we were going to be okay. So that was an incredibly good example of working together and talking. We were going to the registration bodies before we had the vaccine full. We were showing the information, we were talking about it, we were hearing the challenges, what they were worried about, so we could go away and we could actually address that before the product actually needed to get registered. So that's what I would really be urging amongst all of the delegates, all of the nations and WOAH, is let's try and increase this communication and this cooperation together, and then we will deliver what everyone is wanting.
Thank you.
So I think one of the important points is how do we get research out of the lab and transfer technology to the companies? What I've seen in India is that there is a lot of research that's happened, and many of the research institutions have the products in readiness, but there is a bit of a void in the transfer mechanism, which needs to be strengthened, number one. The oversight of the regulatory agencies has to be very, very strong. Number three, as was mentioned by one of the other panelists, that today there is a case to act jointly for all kinds of false or fabricated vaccines. We need to have a good surveillance mechanism. Talking about India, we are running one of the biggest FMD control programs And since 23, we have developed a very good system where each batch of the medicine that is produced, or the vaccine which is being produced, is tested on live animals, and then it is passed. This is to gain a lot of confidence. That is why we are doing it. But the companies or the manufacturing agencies now know that there is a mechanism and we can test it. But we are also supporting our own vaccination program with the surveillance, zero surveillance data, which is pretty much in tandem with the usage of vaccine. So we have to have all of this together so that the farmer who's ultimately administering the vaccine, even if it's free of cost, is not cheated. And I think this is the essence of everything put together. And I think one key takeaway I would like to mention over here is that the vaccines have to be cheap, they have to be easily available, and the logistics has to be managed very, very well. Thank you.
Thank you very much. I think if we can give a round of applause to the panel. It's been really very informative. We were told that we have now an opportunity to get a few questions from the audience. I don't know whether we can take some questions, if some of you have questions. There's one question here. Yep, number 2. I know that my CVO also had a question from South Africa. Yeah, we start here. Yeah.
Ok, gracias. Por favor,
Thank you. Allez-y, allez-y. Thank you very much for all the information that we've just heard. When we were talking about all these subjects, you know, I was thinking about the very complexity of vaccination. You know, COVID brought a lot of good things and bad things also, because we had a pandemic when nobody was expecting it. It was so unexpected, and we had no vaccines at all, and we had no knowledge to face this disease. And because once we had the vaccine available, there was a series of problems to access this vaccine, particularly in developing countries. And this led to a lot of deaths, fatalities. My question is the following, and I would like you to listen to me. What would happen if this happened among animals, if the same thing happened in animals? You know, we have a bank of vaccines for diseases that we know. The use of Pandra magnitude, the use of a prevalence level of the disease. But what if there was a disease outbreak and we know nothing about this disease? So what would you suggest? What would you say in this case? Well, what would you do so that WOAH or other organization can actually face this type of disease, a disease that could emerge out of the blue, and a disease that nobody knows and unexpected?
I don't know whether, sorry, I missed the first part of, but I don't know whether you want to handle the question, Dr. King?
Well, blue tongue serotype 8 for Europe was like that. This was a disease that wasn't expected. There was no vaccine. We got together and we talked. That's why I'm saying the communication is so important. If we saw something that came even bigger, yeah, and we're here, we're talking with WOAH, we've got the relationships. You start sitting down and working out, is this a real threat? What do we need to do? And Schmallenberg, we did also respond to that one, and then that disease just disappeared. We still made a vaccine for it. We lost a lot of money, but we still went for it. We do see this as a social good, as well as just, I know people have said we need to make profit, and we do, but we also recognize a responsibility that we have to respond to these kind of things. So we talk, we make sure that we have the open dialogue and understand what's needed. And then we would also be asking that you looked at new technologies and assessed them and responded quickly. Some of the problems with registration are not at our side, they're how long the registration process takes. We have to find a way of really looking at risk, both of releasing products that haven't gone through full registration, but also the risk of that disease. Let's do a proper risk analysis of where is the true risk and what is needed, rather than just saying, well, we still have to go through a 5-year registration process.
Just one small point, and I'm just repeating something that I think you, Bati, and others said earlier in this forum. And it's easy to lose sight of the fact, because the COVID-19 vaccine response was so spectacular, that it built on 20 years of basic research. Those platforms were ready, and it was a case of plug and play as soon as the genetic, code of the virus was available.
Yeah, that's a great point, I think, yeah. You also want to add? Yeah?
OK. Non, je veux simplement indiquer que nous assistons.
I wanted to say that we can see the approval of new vaccines on the market. And as part of the process to develop vaccines, we have to be, for the institutes that develop those vaccines, we have to test the safety of the vaccines and the efficacy of the vaccines. If we are meant to use these vaccines, we have to be 100% certain that they're safe, efficacious also. So we need to have a process to facilitate the approval of these vaccines and facilitate the registration of these new vaccines. So with the studies for safety test and efficacy test, well, this facilitates the adoption of these new vaccines to control diseases. So I think it's important to stress this and to move in this direction. Thank you.
I think there was another question there, and then Dr. Modisane. Yeah.
Yeah, thank you very much. This is Dr. Sufyan, delegates of Bangladesh. So all the panelists described very nicely. So we used vaccine for disease control, disease eradication, and one important thing is maybe to control the pandemic potential also, because maybe in near future, maybe antimicrobial resistance is one of the pandemic potential threat in our South Asian region, because we have lots of people and lots of livestock population, and we use lots of antibiotics also. So for this, just a question to Secretary India. So regarding our region, we are facing lots of problems, and as you mentioned that in India, lots of vaccines are produced on local manufacturing and very good quality. And in our region, we have neglected tropical diseases. And as you mentioned, we have a pandemic potential threat also. We have avian influenza. And we have some endemic disease also, FMD, PPR, and recently emerging diseases, LSD. So do you have a plan? Is possible through the SARC or some other anything to produce a vaccine bank to control these diseases? Thank you very much.
Thank you for raising this question. Most of our manufacturers, they are supplying vaccines to many of the African nations and other Southeast Asian nations as well. We would be very happy to do so. In fact, when LSD breakout happened in 22, Nepal reported some cases, and I remember in my office, we had the diplomats coming in from Nepal, and we said we would be very happy to do so. In fact, through diplomatic channels also, we are happy to cooperate in the region. You've mentioned about SARC, you also are aware of some of the situations, but the forum can always be used. We do not have any problem in supply of the vaccines to the nearby nations. And except for H5 or HPI, which is, a problem across the world, we have self-sufficiency in all the vaccines.
Thank you very much. Dr. Modisane, do you still have your question? Sorry, it's my CV, so I need...
Thank you very much, and good afternoon to everyone, all the great minds in this hall today. India just spoke about a question that I was going to ask, considering the devastation that avian influenza is actually causing throughout the world. With all these minds, why are we not moving on encouraging countries to vaccinate against highly pathogenic avian influenza? We know that there are issues related to trade that might influence the decision, but we also know that there are concerns about the possible masking of the disease and it being given an opportunity to mutate, but certainly that disease cannot defeat the great minds in the world in as far as vaccine manufacturing is concerned. The other question that I had, Chairperson, I had an opportunity to speak to Dr. Schumacher and the other Dr. King during the break, just to ask them, and I think Donald was trying to maybe also indicate that they might have considered that, related to authorization of vaccine use in a country and registration, because the thinking is we should be in a position as an animal health fraternity to share registration information with other countries that may want to use the registration information that was used to register one vaccine in one country, so that the other countries can at least authorize that vaccine rather than if they don't want to register it. So what is the difficulty related to that? Merci beaucoup.
I think for the first question, I think it will be covered in the session 4, issues of trade, because it's a very, session 5, it's a very important component of vaccine demand, which I think will be really covered tomorrow morning, I think. So I'd keep the question and we'll make sure that we address it. I don't know whether there's a panelist who want to handle the second question from Dr. Modisane. I heard, Donald, I heard your name.
So did I. So, no, we'll just, it's related to that question. I can't really answer the substance of it, but it's an important prompt to say one thing about pre-qualification, that it does not replace, it is not doing the job of national regulatory agencies or the registration work, but it can help, it can assist that process. And I think when pre-qualification is done, like by the World Health Organization, there's very close collaboration with national regulatory authorities.
I think with processes like centralized registration or mutual recognition and so on, in such systems, using information from another agency can be done. I mean, the product that has been registered in one country, the information or the pre-approval can be sort of used in another. I think that's what you're doing in your system in West Africa.
This is exactly what we do in This is exactly what we do in Western Africa. But we need to have a standardized process. That helps save time. So we do that in West Africa. And I would encourage others to do the same, to extend standardization so that we can authorize vaccines and drugs for veterinary use all over the African continent. Thank you so much.
Carolyn, but I think we're running out of time. I don't know whether we could take Carolyn comment in answering this point. If we can get the microphone.
Thank you so much. And I would like to respond to our colleague from South Africa. As you could see in my presentation, obviously registration and regulatory affairs capacity are recognized as one of the biggest hurdles. And so I cannot stand here and just say we have recognized this, but we're not doing anything. And so I am fairly comfortable to share with you that we have a new project in GulfMed which focuses on better regulation in Africa. And as part of this project, we will organize the first ever consultation of regulatory heads from the veterinary sector this November. And it is a question of convening the responsible people to chart the way forward, because it is absolutely clear that not communicating among the agency, even though they obviously get along perfectly fine, it is not the right way to go. So communication between the regulatory agencies is absolutely critical, and we will start working on this in Africa. We will support that process at GulfMed. Thank you.
Thank you very much. I think we should be moving to the summary. I'll ask Mary-Chelle to summarize the session.
Well, thank you very much. I always have the nice challenge to summarize in -2 minutes. So that was a very interesting discussion, as you have seen. So we spoke about registration, and we heard from Dr. Teko about the centralized system in ECOWAS and how well it is working. And we also heard about the process in India and how the industry and the regulatory authorities work together. We also heard from Dr. Teko how they have specific provisions for emergency vaccines, but the importance of follow-up. We also spoke about pre-qualification and how it is moving now from a proof of concept to the next steps. We're going to pilot and we're going to operational, and looking at in a cost-effective way and developing a business model to see how it can be expanded, and even then applicable to other diseases. Another very important point we talked was about quality assured vaccines. And we spoke in India about the national level, but Dr. Boja spoke about the importance of doing it independently at not only a national, but regional or continental level. And talking about quality vaccines, we also brought the issue about counterfeit and substandard vaccines. And there was a clear request from WOAH to provide some support in this direction. And then we also talk about the vaccine banks. The vaccine banks are really an incredible tool to provide good access to quality vaccines. But we heard very clear, good planning, and something that we keep hearing in all the sessions, communication. Good communication. If we want public-private partnerships to work, we need good communication. And the bank is underutilized, so we really need to make it work better. And lastly, we heard the importance of the vaccines need to be affordable, because price is also part of access, and we need the vaccines to be affordable, and that was a very clear message from India. With that, I hope I summarized everything, so thank you very much.
Thank you very much to the panel. Really great contribution, and very grateful to the time you put into this and for being part of this. Thank you. Thank you.
Thank you.
Thank you very much, indeed, for summarizing all this information. Thank you, Dr. Donadeo, for summarizing all this and for this really enriching conversation. This session gave us the opportunity to speak with key actors about the mechanisms that could improve the national procurement process, and also gave us the opportunity to understand what is happening on the floor. And as a result, to access to high-quality vaccines, that is what we are all aiming for. So I would like to take this moment to come back to the part of the title of the forum, Reflection for a Change. What we're hearing today are real-life experience and concrete solutions for those that are in the front line of implementation. And we have here a clear voice since yesterday with the ministers that promoting vaccination can be a concrete solution.
And you may have noticed the pins we are wearing today. They serve us as a reminder that high-quality vaccines not only help us prevent disease, but help reduce the need for antimicrobials. We must not forget that AMR is a global threat and a threat to One Health. Vaccination offers us a way to act together across borders, across professions, across sectors, to save lives and protect our shared future.
Exactly, and we are not going to throw this to you because that could be dangerous. So you can visit the AMR Street, is our kiosk that is in the room 101, and you can pick your pin and help raise awareness about antimicrobial resistance. And now let's move for the last technical session of the day and the final session of today. What happens once we have the vaccines?
That's a great question, Mariana. Unfortunately, we're joined by the right group of experts to help us answer it. This next session will take us into the technical side of effective vaccination. We'll explore how to use epidemiological data to plan strategically, how to select the most appropriate vaccines, how to monitor effectiveness after vaccination, and how to adapt surveillance systems, whether to demonstrate disease freedom, detect outbreaks early, or track ongoing threats. We'll go back to our fictional member of Noroland to see where the story has progressed. Let's listen in.
You can't vaccinate everywhere, so how do they decide where to vaccinate first?
For this, we take into account disease spread patterns, risk areas, animal movement data, and we vaccinate strategically. Doing this, we can maximize impact and minimize cost and disruption. We have to remember that vaccination cost is lower than vaccination operation, so we have to take into account budget as well.
But outbreaks are unpredictable, so how do you ensure decisions are made in time?
Well, speed is crucial, but so is accuracy. If we vaccinate too broadly, then we're wasting resources. And if we vaccinate too narrowly, then we risk not controlling the spread of the disease. We need a balance of epidemiological modeling, real-time surveillance, and resource allocation. To have all of these, we really rely on information reported to us by livestock keepers and animal health workers.
And what about public perception? Do farmers and producers always cooperate?
Not always. Some fear economic losses due to trade restrictions. Some fear the efficacy of the vaccinations. But it's important in these cases that we communicate and build trust.
Let's keep going. Dr. Donadeo, the floor is all yours.
Thank you very much. Can we have the slides, please? Sorry, you have me again, but there you are. So we are going to talk now about strategic vaccination and paving the path to a healthier future. So we are really talking here about the last box of our figure, about vaccine demand, and also how we go from vaccine demand into vaccine adoption, that is vaccination. And what do we mean with vaccine demand? With vaccine demand, we mean that the animal owners, the farmers, and the vet services, they are aware of the vaccine and they want to use them. They want to use the vaccines because they value the benefits. We also mean that vaccination strategies are designed and implemented as per national and international standards. Vaccinovigilance is in place and vaccination is accepted by the population. That's what we mean with demand. And with vaccine adoption, we mean vaccination. I spoke earlier this morning about some of the challenges and some of the opportunities, how we need better guidance depending on the objectives that we want to achieve, and what we have to have into account technical considerations, but also socio-economic considerations. And that's when we heard about communication, how important it is. Monitoring and evaluation. If we want to know how well we're doing and which things we need to change, we need to focus on monitoring and evaluation. That's extremely important. Vaccinovigilance. If we really want to develop the trust, we need to have strong vaccinovigilance systems in place. And lastly, about funding vaccination programs. And we already mentioned earlier about the limited funding and how we need to look and how we can be more efficient. I talk about integration. So once we go, especially in remote areas, once we catch the animal, might as well vaccinate again what is needed. But we need to be a bit broader-minded and maybe not only about vaccines. So if I'm vaccinating a dog for rabies and in a place that there's leishmaniasis, maybe I can put the collar at the same time. So we need to see how can we integrate with other diseases, how we can make our health systems more robust. But we need to look at the evidence of that, because sometimes we think it might work, but we really need more evidence. So the importance of data, the importance of monitoring what we're doing, it's very important. And for that, we are going now to have a panel discussion, and it's a great pleasure for me to introduce the panelists. And first of all, I would like to invite Dr. Masatsugu Okita, who is the Director of the Animal Health Division, Food Safety and Consumer Affairs Bureau, and WOAH Delegate of Japan. Dr. Matsu. I would like to invite now Dr. Marie-Christine Legal, who is the Chief Veterinary Officer and WOAH Delegate of France. Dr. Ramanan Laxminarayan, who is the founder and president of the One Health Trust and director of the WHO Collaborating Center on Antimicrobial Resistance in Delhi. And our last panelist is Dr. Phil Hadley, who is the Secretary General of the International Meat Secretariat. Well, thank you very much, all of you who agreed to participate in this session. So, first of all, we are going to start with some quick questions. No, one question, quick answers, okay? In 2 minutes, I would like each one of you to explain, in your opinion, what is smart vaccination and what are the critical elements. This is speed dating, 2 minutes, one, okay? We'll start with you.
Okay. Thank you very much. I try to finish it within 2 minutes. Well, most important thing, the counting is there. The most important thing is we need to think that the vaccination is just a part of the entire animal health program, animal health strategy. So within the entire whole picture of the animal health, you need to think about the vaccination. Otherwise, it doesn't work well because the vaccination is not a standalone thing, all related. And every various thing you need to think about, you need to consider. This is a very important thing, I think. And also, I would like to highlight that the circumstances surrounding you, that is also a very important component to make a decision, because the world now is really, really changing. Nothing is stable, nothing is as it was in the past. So all these things you need to think about, otherwise the vaccination doesn't work well. I think otherwise, other things are various, but maybe quick answer will be sufficient. Thank you.
Thank you. Maxine.
Merci beaucoup. Je vais...
Thank you very much. Sorry, I'll speak French if you don't mind. So, what's smart vaccination strategy? Well, in my mind, it would be an exhaustive strategy that would include all stakeholders. And to me, that's very important. And this is what stands out from all the discussions that we've had so far. We talked about how we can encourage vaccination. Yeah, it's complex because there are many factors involved. And there are many stakeholders and many levers that we need to use. So we said it, and previous panelists said it. Vaccination is not a miracle solution. You have to explain what vaccination is about. What are the limits of vaccination? It's not a miracle, but should not be an obstacle either. So we have to explain clearly what you can expect from vaccination. It's one tool in addition to many others. We talked about biosecurity, and we have to explain what you can expect and what you should not expect from vaccination. And this is something that we need to put in place when we talk about smart vaccination. So we need to work with all stakeholders, whether vets or farmers, or scientists working on these matters. But then there is also financial support. That was said by our General Director yesterday. We need financial support. And there is also the importance of political support. We need strong political support. We were talking about communication, of course. That's key, so that we can move towards smart vaccination. And then, again, vaccination is not just about a vaccine. Okay, I've got 10 seconds more. For a smart vaccination strategy, once you're vaccinated, you need to have surveillance in place, and vaccination is not just about the vaccine.
Thanks for the opportunity. I think I'll come at it slightly differently, both from a slightly more economics perspective than what was offered, and also from someone who actually works more on human health than really on animal health. The big difference I see between human and animal health with respect to vaccination is that with human health, there is a lot of attention on burden of disease. With animal health, it's a lot to do with the commercial proposition. But that said, there is a mistaken notion perhaps that this value is only a private value, but that there are at least 4 reasons why smart vaccination should unlock other values of vaccination. One is farmer well-being. This is a great tool for reducing poverty, so it's a development agenda. The second is with climate change. If you can increase farmer productivity, then you can produce the same amount of milk or same amount of meat with fewer animals, and therefore there's less emissions. We should be looking at outcomes like carbon footprint per liter of milk produced, and their vaccines can improve productivity and has social value. A third value is in pandemic prevention, which has been discussed quite a bit, which is again a social value. It's not a value that we can expect the farmer to produce. The fourth value is with respect to antimicrobial resistance, which again is a societal value, which we're asking the farmer to do something not in their best interest, but in the interest of all of society. Unless we, as people who are interested in the space, can articulate well these 4 values and therefore bring greater global attention to the need for animal vaccination as a tool for achieving all these other objectives, which are different from the farmer's own commercial objective, which is what we tend to focus on, we will not be doing smart vaccination. Thank you.
Thank you.
Okay, so 2 minutes, that's a lot of pressure. I think, but to keep it really quite succinct and to pick up on the point there, from a meat sector perspective, I think one of the big challenges or one of the big opportunities is that the sector is being challenged to produce more protein for a growing consumer demand. And we need to do that mindful of the environmental impact of doing so. And there's no doubt that production losses have a significant impact on efficiency and on the availability of protein to support that growing population. And whilst vaccines are available, uptake is slow or limited for a number of reasons, many of which have been picked up by the other panellists here. And I think the real challenge for us all to wrestle with, and I'll speak from a commercial perspective, is how you deliver the value back to the supply chain for the benefits of vaccination within the animal health arena. And you need to have effective vaccines that are available, easy to administer under often difficult circumstances. They're viable in terms of purchase cost, and whether that be purchased directly by the producer or through a government-private partnership platform. Their benefits need to be clearly communicated, and the commercial responsible business person needs to understand the cost and value of taking such action. And when you can communicate those clearly and you have the tools available, you drive the uptake and you get the result we're all looking for.
Excellent. Thank you very much for keeping your time and also for some great responses, because you complemented each other. And I think it was great. So we'll talk about how it's a tool more, the vaccination, the role in society, the communication, the economic benefits. So it was great. So thank you very much. Now, I have some questions for each of you. I'm going to start with you, with Dr. Mata. So Japan's response to lumpy skin disease and classical swine fever has included the strategic use of vaccination. However, vaccination is not used to contain HPAI. So could you share how epidemiological data guided the decision to implement vaccination, and what lessons Japan has drawn from this experience, please?
Thank you for the question, and I think that is very appropriate because you can, by sharing this information, you can compare why the vaccination is done, while the other disease vaccination is not used. And the decision for CSF, I mean, okay, as I said at the beginning, it's a changing world. And nothing is predictable. Everything is unpredictable, and we have not expected the reoccurrence of CSF, because CSF, when we had the first case in 26 years, in 2018, it was totally unexpected, because that was eradicated for a long time, and after that, the situation is going to what includes the infection in the wild boar. And wild boar involvement in the infection, that makes the life really, really difficult. And the spread is, uncontrollable. And from time to time, the transmission or spread the virus from the wild boar population to the domestic population. That kind of thing is very makes us a really tough situation, and that's why we decided to apply the vaccination, because in the past we had a very good experience of controlling this disease by using the vaccination. And same vaccination, same vaccine strain we are now using to control this CSF. And this time, because of the new occurrence of the spread of the disease in the wild population, we also used the bait vaccine to control the spread of the disease among the wild population. And together, all together, we are now trying hard to contain the disease. And lumpy skin disease as well. This is in last year, November, we had the first case in the history. So indeed, I was so impressed that everything can happen, and that I think you need to keep in mind. But we were a little bit prepared for that because we already looked at the things happened in the neighboring countries, and we prepared to some extent, and we had an control strategy which includes the vaccination, and together with the combination of the other control measures and vaccination, we successfully controlled the disease spread. But at the same time, we had a lesson from the application of the vaccination on this. One thing is very important to keep the experience and lessons into the updating or the modification or improvement of the strategy, not only the vaccine strategy, but also the entire disease control strategy. And we use the data to feedback to improve the control strategy for both CSF and LSD. And in the case of AI, so far we have not used the vaccination because so far our control measures worked quite well and without vaccination. But now these 5 years, we have experienced 5 consecutive years of keeping the disease, while in the past the occurrence was once in a while for some years. But now 5 consecutive years we have the case, and sometimes very severe. And I think really the things are changing. And we are now at the point of thinking seriously about the application of the vaccination as an complementary measures for the entire HPAI control strategy. I think that is the current situation of Japan.
Thank you very much. That was very interesting to see how you have evolved and how you keep changing and adapting to the circumstances. Now I will move to Dr. Legal. I will make the question in English. My Duolingo score is not that long, not that high to make it in French, so I will have to stick to English. So France has been using the HPA vaccine. So how did you balance the acceptance and uptake from various stakeholders? You know, to how the producer expectations, the social acceptance of the strategy, the trade restrictions, how do you manage to balance all that?
Merci pour la question.
Thanks for your question. I'll answer in French, and I will start with what was said this morning when a question was asked about to vaccinate or not to vaccinate. So let me go back to Shakespeare and say that he was a turning point in the history of theatre, in the history of art. Some people thought that he was going too far, others thought that he was not going far enough, and this led to a debate in society. And then it was accepted, and now no one has any question. He's a hugely famous author, and everybody loves him. So with vaccination, we try and do the same thing. We had an approach which was not usual. We tried to put something in place with all the stakeholders. Some people may have thought that we were crazy, but we decided to continue and move forward and look at the issues collectively. So, yeah, you want vaccine as a tool to be accepted. We were talking about vaccine availability, but before vaccines are available, they need to be accepted. And that's something that we worked on with all farmers and with the public at large and with the policymakers. And we'll talk about it tomorrow, and trade partners also, because there is a challenge here to explain to trade partners what's at stake. So yeah, we looked at the issue from different perspectives. We looked at how we could talk to farmers. We had many steering committees in place to raise the questions that were raised in the video, like should we use the vaccine in this place or in that place, or for which species? Is it mandatory? Who is going to pay, etc.? And all this was monitored on a regular basis by all stakeholders, because we soon realized that we couldn't make the decision in our offices in Paris. Then we talked to our partners, trade partners, to provide reassurance, to establish trust, and we had support from multilateral partners. We had support from WOAH to convey these messages and to provide reassurance, because we understood how important it was for our partners to understand our strategy and to understand that our strategy was safe. And then for our trade partners, they wanted surveillance. And this is what I said when I talked about smart vaccination. We had to provide reassurance, so we had to put surveillance in place. And that's what we explained to our partners, to explain the measures that we put in place. So we had health diplomacy that we practiced, and then consumers. And we had many different types of reactions, like people who were concerned about the residues that they could find in the products. So we provided answers, we anticipated that, and then the public at large, they accepted vaccination, just like our trade partners. So we understand that with explanations on the long run, I mean, you can't do that in just a couple of days. It took time for people to be convinced. But we also talked about money, how you finance, you fund vaccination. Well, this project was also supported by a robust digital system to feed back data, because if you want a good strategy, you need to have access to robust and reliable data, and you want to be able to share that very easily. So when you talk about setting up a vaccination campaign, it's not just about the vaccines, it's also about everything around the vaccine, which is key. I mean, traceability, all the data we can share with our commercial partners. This is what we used to convince and demonstrate that we were not crazy and that we were putting something in place that was trustworthy. And that's how we convinced our partners, and that's how they placed their trust in us.
Thank you very much. That's an amazing journey, and thank you very much for sharing it with us. I will move now to our next panelist, Dr. Ramanan. So, the link between vaccination and antimicrobial resistance is often overlooked or even ignored. Why do you think that's happening?
Thank you for that question. In truth, the link between vaccines and antimicrobial resistance has been ignored in human health as well. In fact, about 5 years ago, I would say we had very little evidence. We thought it was important, but we didn't have very good quantitative evidence linking vaccination use with reduced antibiotic consumption or reduced burden of disease. And that has changed quite a bit in the last 5 years. The One Health Trust has worked with the WHO. There's now been multiple papers that have come out which establish that link quite well, which are data-driven. In the animal space, the first step is with understanding the antibiotic use itself. We've done it out of habit for a very, very long time. And I think, as most people in this audience would know, we've done it as substitutes. The antibiotic use in animals, even for metaphylaxis or for growth promotion, is a substitute for not having the right breeder stock, for not having good herd health, not having good nutrition, not having hygiene, and also not having access to veterinary services. And in fact, over time, the average daily growth of animals as a result of antibiotics has actually been coming down. So in other words, this was very valuable 40 years ago when we didn't have all of these. In today's optimized farms, the antibiotics don't do very much at all for growth promotion or for metaphylaxis. There are many other ways in which you can achieve it, and many ways in which you can achieve it, and actually reduce the costs. And vaccination is one of the ways in which you can achieve it. And Europe has shown by removing medically important antibiotics from animal use for quite a few years now that this is entirely possible. Now, when this first started in Sweden, I think in 1985, yes, the bottom 3% of farms went out of business because they didn't know how to do it, but everyone else survived and they did it. And that's what you see now in major parts of the world, which is the producers who don't have, who don't operate on the best principles are the ones that are affected, but most producers are able to move beyond this. So then it comes to the question of the vaccination itself. And here, I think the fact that vaccines, as part of a broader set of biosecurity measures, as you mentioned, it's not a standalone measure, can be a very cost-effective way where you remove the need for antibiotics at all. You're not paying for the antibiotics, which is an expense as far as producers go. And this is something which has not been recognized. People do it much more out of just habit of doing it. And I think even in the US, for instance, the guidance 213, which said that you needed veterinary support in order to provide the antibiotics, forced producers to really think, well, do I really need to call in a vet? Can I do it in some other way? And once the economics of that changed, and everything is driven by the economics of it, you had, not only were they going in the direction of not using antibiotics, they were actually advertising it as, we raise our meat without antibiotics, period. Something you would have never imagined would have been the case. And it happened entirely because of economic incentives. From there, it went to consumers. Now, consumers, for a long time, have not been aware that the meat that they consume has been raised using antibiotics. Again, going back to the Swedish example in 1985, when the first time in Europe antibiotics were taken out of meat, it was not done out of a concern about AMR. It was because the Swedes realized from a newspaper article that there were lots of antibiotics going into the meat, and it was the use of antibiotics that was of concern to them, not AMR per se. And this is now happening in many parts of the world where consumers are realizing they don't want the antibiotics in their meat, and that again is a forcing function for now recognizing that vaccines could be a way in which you can reduce that antibiotic consumption. And I also think that the animal sector itself has been somewhat slow in recognizing the consequences of AMR in terms of being able to treat animals themselves. AMR is not a concern just for humans, it's a concern for animals. In fact, we published a study in Science about 5 years ago which showed that between 2000 and 2016, drug resistance in animals had gone up about 16%. So this is a serious issue for animal health itself, and that's a good reason, again, to use the vaccines. And I think the UN General Assembly resolution that's been spoken about that happened last year was a real turning point in two respects. One, it made a commitment to a substantial reduction are the words used in that resolution, in the use of antibiotics in growth promotion and in animals. So that commits the world to doing something significant. I don't think 10% is substantial reduction. I think at least 40% is substantial reduction, and I think WOAH's own stats showing that we're on track to achieve something like that. But it also very clearly highlights a role for vaccines. And so vaccines are very front and center, and I think we've arrived at this moment from not having recognized its value even 5 or 6 years ago. If you look at the 2016 resolution at the UN General Assembly, you don't have the same strength of language on vaccines. But now I think we have that recognition, and we have the evidence now that's building to move forward. Thank you.
Excellent. Thank you very much. This was very interesting. Now we move to Dr. Phil Hadley, and I have a very good question for you. So, from the producer's perspective, what makes vaccination an economical viable choice? What are the tipping points where farmers either adopt or reject vaccination?
Thank you. That is a good question, and I'll try and give you a good answer. So I think the question starts on the assumption that the communication is there, and that's been raised previously, and that the producer, the farmer, can understand the communication. So I think the importance is clear communication around why a producer should implement such a strategy, and the impacts that it will have, and indeed the impacts that not taking the zero, no action approach will have on their business or their livestock. And I think it has to be placed in the context of there's an awful lot of information available or pushed to farmers, and it's sometimes difficult for them to understand and distill down the key messages. So I think there's a real need for clear, concise communication that has clear cost-benefit analysis that they can understand, and they'll need support with that, and that may be through their veterinary advisors, it may be through on-farm support, it may be through trusted government representatives, etc. So I think distilling the messages down so farmers can be in an informed position to be able to make those decisions in the first place is the first step to going down that vaccination pathway. And then coupled with that, in terms of do I use or not, it's around the factors of things like the efficacy of the vaccine, the ease of use with producers that might not have great facilities, might not have staff that are trained or staff that are available to be able to administer vaccines. How often is it a multi-vaccine? Can they administer it alongside something else? The actual practical role of putting the vaccine into the animal, it isn't necessarily, although it's really important, and we've talked about cost, it's the actual cost of the labour, the facilities, etc., of implementing that strategy. And if all those things are in place, then we have every chance of success. We have to also think about the bigger picture, which has come up through some of the videos, which is the implications of trade. If we vaccinate animals, does that mean our export markets or our domestic market becomes curtailed in some way? What's the financial cost of that? We heard in the FMD session at lunchtime that Germany's implemented a successful strategy on containing their disease outbreak, but they're yet to understand what the full financial cost of doing so, and part of that cost is the impact on international trade and export markets. And I suspect ultimately that's going to turn out to be a huge number. So the cost of that to the producing sector also has to be figured out. So when we get there and we're at the point of making the vaccination and thinking about the financial perspective, we also need to balance does the cost lie with the producer? Does the cost lie in some kind of government, public-private partnership to be able to make that, help make that decision and make it a viable choice, and hopefully achieve the outcome of curtailing or preventing disease and improving productivity and bottom line and the positive impact that has on sustainable meat production.
Thank you very much. Again, I keep hearing communication, communication, communication. And so I think it's a very clear message coming all across the session. And also the very important messages like trade, and we're going to talk about that tomorrow morning. And now we still have some time for some questions from the audience. So I would like to pass questions to the floor. Are there any pressing questions? I can't see very well, so up there, are there any questions? Yes, here. There's a question here from the UK and then one from Australia. Oops.
Yeah.
Christine.
Yeah. Thank you. So a question, if I may, to both my French colleague and my Japanese colleague. In your decision to vaccinate, what's the one thing that would have made it easier?
Unless you went first.
Oh, well, I think for the decision, you need to think of various things. And for me, biggest, I don't know, it's not the biggest thing, but one of the biggest things would be like the discussion now, the communication with all the stakeholders. I think that is really, really necessary, and but yet very difficult. Grab the exact, demand within each stakeholder component party, and I think that is very important. I have the example of that. You see, in the farmers group, when we decided to applicate the LSD vaccination, the negative impression was prevailed in the farmers because there's a severe side effect. And but actually, it's not a real side effect, but something related to the administration route. And if you administrate the vaccine in a proper manner, that will make a very difficult situation or damage the animal. And we clearly separate these two things. And what is actual side effect, and what is the bad administration or bad measure, and then clear communication with the farmers, and that was very helpful for them to go easier for vaccination against LSD. I think that is one example of how we overcome these kind of difficulties. Thank you.
Thank you.
Merci pour la question.
Thank you for the easy question. First of all, we need money. Money. It's all about money. A lot of money, unlimited resources, and we can vaccine against anything. Money in the first place is what matters, and then a guarantee to maintain our main export markets. We were able to sustain them, but initially we didn't know. So when we make the decision before or after, at the start of the discussions, if we knew that we had a lot of money, and if we were aware that we would not lose our main markets, I think that the discussion would have been a lot easier.
You did very well with this challenging question. Huh? Where's another question from Bev from Australia?
Thank you to the panellists, a very interesting discussion. And I think I will take us back to the communication theme. We have heard from several of the panellists that it's not just about the vaccine, and we've also heard about the social values that can be placed on vaccination. In an environment where in some contexts we see increasing vaccine hesitancy from livestock owners, as well as consumer concerns in some instances about the products that they are eating or consuming, I'm interested in the role that you see for behavioural scientists and the social sciences in underpinning our communication to help with this problem of vaccine demand in some contexts.
And thank you very much. Anyone?
Merci beaucoup. Quelqu'un souhaiterait commenter, y répondre? Just to explain, to talk about for instance, the French experience in this regard, I have to say that we can see there has been some strong reluctance against vaccines. AIDS is a good example. What also helped us is that we were deeply affected by the disease itself, and when realized how serious the consequences were, the risk-benefits balance, they looked at it and people agreed to endorse the risk. If we had been less affected, the conversation would have been a bit more complicated. But because of the seriousness of what happened the previous years, there was like a change, a major shift. And for a shift to occur, we need to make a decision, because we have to make two choices that are complicated to make, and two difficult decisions. And in a way that was very helpful. And to reassure consumers, we We got some support from social sciences and scientific research was made on the products to show there was no trace and no reason to be concerned.
Please.
Well, I was just going to add to that I think there's a tremendous role for social science there, because often when it comes to production practices, consumers make a decision based on lack of information. So I think the industry and the support services need to be open and clear and transparent in what's going on and what the outcomes are, and indeed what the risks are. And only then can consumers make an informed choice. And many social science studies in those kind of questions start off with a negative response, and then when you step through 4 or 5 communication routes, they end up going, yeah, I'm okay with that. So I think it, and it has come out repeatedly, it's about openness, transparency and communication. Why are we doing this and what does it prevent? And often it prevents disease outbreaks and animal suffering and so on, which most consumers can get on board with.
Excellent. Thank you very much. Are there any other questions? Oh, yes, there's a question there. Oh, here. Oh.
OK. Oui, merci beaucoup.
Thank you very much. I would like to congratulate the panelists because they addressed the discussion and the question with a lot of, they're very comfortable and they were very transparent when they addressed the question. So my question is the following. The trend is, there's a growing trend against the rejection, with the rejection of vaccines and vaccination. The international health regulations imposes countries to notify report cases. As far as WOAH is concerned, what is provided with regard to this? What is planned?
Anyone wants to answer that question? I think it's a question more for the WOAH members. So I think we have tomorrow a wonderful session 6 where WOAH will be available to answer all your questions. Is that correct, Monse? So with that, I would like to invite Bati now to summarize. No, we've run out of time. Sorry? This thing says that we're going to explode, so we need to, I'm sorry. Session 6, and remember to send your questions with the QR, so tomorrow in session 6 we'll go through all the questions. I'm sorry, I apologize.
Sorry, I'm stuck here. Thank you again, and thank you very much to the panel. I'll try to put together the point that came up, and I hope my summary really capture what you've said. We heard from Japan. Japan highlighted that vaccination strategy must be disease-specific. I think we heard about the situation that they had with the 3 different diseases. There's no one-size-fits-all, in other words. So we also heard that strong surveillance and post-vaccination monitoring are vital, not just to detect the disease early, but to prove freedom, monitor performance, and ensure vaccine safety. So that was Japan. And then from France, we heard that strong vaccination strategy must be underpinned by biosecurity, clear outbreak rules, cross-sector cooperation, consistent political and financial, and we heard again strongly the communication support. That was a very, very strong message, which I guess has come from everybody in the podium. And we heard about the issue related to the use of AMR. I think the global recognition on the importance of AMR for animal health, I think that has come quite strong through the UN recognizing that aspects. That the AMR issues from the animal side in terms of animal welfare and productivity are quite important. So the impact on vaccine adoption, we also heard how vaccine can drive a shift away from antibiotic reliance, improve productivity and health outcome. Countries should adopt policies such as differential pricing for antibiotic-free meat to incentivize vaccine use, reduce antibiotic reliance, and enhance animal health and farm productivity. In terms of vaccination implementation at farmers level, greater uptake of vaccine require not only effective, affordable products, but also an aligned global position on vaccination and trade to avoid discouraging its strategic use, which came earlier. But then additionally, I think on pharmacovigilance, I think it's required to detect any adverse events and develop confidence into vaccination. I think that's a critical point that need to be brought up. So I think those are the points that I think came quite strongly through the discussion, and thank you.
Thank you very much, Bati. And thank you very much to wonderful panelists. You have been great with your answers and sharing all your knowledge. So thank you very much. Please help me to thank.
Yes, thank you, Dr. Dungo, for providing that excellent summary, and thanks to our esteemed group of experts and to our chair for that really insightful discussion, which I feel has led us up quite nicely into tomorrow's session. And it's also generated questions for everyone. What are the desired and undesired consequences of vaccination? Is trade always open to vaccination? What about trade restrictions? I also heard from the panel about communication. In fact, as Dr. Donadeo highlighted, it's a theme from many of the panels, is communication and also the threats of mis and disinformation. How does this affect vaccination campaigns?
So many great questions, Anne, and I cannot answer any of them. So tomorrow, we will answer this. We will explore these topics further tomorrow in our 2 remaining sessions, technical session number 5 and technical session number 6. Tomorrow morning, we will close the topic with a discussion on trade and social acceptance. And during this final discussion, we want to hear from you, as we have been doing today too. Thank you for participating in this forum. Tomorrow in session 6, the second session of the day, we will answer all the comments that we have been receiving from all of you. We have already received more than 70, almost like the number of nationalities of WOAH staff. There's a lot of them. So we will address them with our distinguished panelists tomorrow in the morning in the 6th technical session. I have a disclaimer for you, this time in French, because we haven't get to the quorum for the adoptions of resolutions. Nous avons pas atteint le quorum.
We've still not reached the quorum for the early adoption of various resolutions, but via the UK Engage platform. So that's platform number 1. So please, it's the last day for those delegates having a voting right to vote online. To vote, please log in to the delegates portal, and then on the web page you have a dedicated part dedicated to the general session where you can find the link so that you can vote. Thank you so much for voting. You have up until 11:59 tonight. Vote is closed tonight. And if you encounter any problem, please go to our IT kiosk and our IT experts will help you sort out any problem you may have.
Rapporteurs, our chairs, and our wonderful panelists for this really rich and thought-provoking day. We invite the Assembly to rejoin us tomorrow at 9 a.m. for the final sessions of the forum. And don't forget to also enjoy this beautiful city of Paris. So many wonderful monuments to see, excellent food, especially croissants, my favorite. Mariana, would you have a recommendation for our guests? Perhaps a restaurant?
Ooh, I have so many, but unfortunately, I don't think that there's one that fits all of us. So I will recommend you an area. If you walk 30 minutes away along the Seine, you will find Saint-Germain-des-Prés, where you can find all these cozy, nice Parisian restaurants, the classic ones that you have in mind. And you have a really iconic one. It's the first Parisian cafe that's still open since 1686, since the 17th century. So you can visit it. And you, Dan, what can you recommend us today?
Well, for me, I love history, and one of my favorite buildings in Paris is the wonderful Pantheon in the 5th arrondissement. And if you go there during opening hours, you can climb up the stairs to the top of the dome and have a wonderful view across the city. I also love running, and tomorrow I'll be going for a run along the Seine at 6 a.m., so you're more than welcome to join me if you set your alarms early enough. And Mariana, you going to join me?
I will be sleeping. No.
Next time.
So see you again tomorrow as we come together once again at 9 a.m. right here, ready to vaccinate our minds with one last dose of knowledge. Thank you.
Merci.
And gracias.